Well, good morning, everyone.
Good morning.
I think I had the privilege to meet most of you, but for those of you that are meeting for the first time, my name is Sharma Dwivedi. I'm the Dean of the Canadian College of Homeopathic Medicine. It's really a privilege to have you all here. So on behalf of the Paganum College of Homeopathy from UK, who have graciously offered to co-host this international conference with us, and the Canadian College of Homeopathic Medicine. I know everyone worked really, really hard in the last 3-4 months, both in UK and here in Canada. Andrea, Kerry, Neil, Jude, Joyce, they all put everything they had into it to make this to happen. So thank you all. It's really wonderful to have you with us. So I'm going to share with you the agenda for that. If when I press escape, I leave this, or it doesn't stop it. So today we're going to have lectures. I was going to share the agenda with you, but for some reason it doesn't switch the screen. The agenda is very simple. We're going to have a 15-minute lecture, 10 minutes break to allow to switch. So we're going to start, hoping to start on time, 10 o'clock, 11, and 12. Unfortunately, John couldn't meet us in person, so he's going to have his presentation by Zoom at noon. And another friends of us from UK couldn't get a visa to come to Canada, so he's going to do his presentation at 2 o'clock on Zoom on aplastic anemia. And again, unfortunately, Dr. Sharma is stuck on traffic. Apparently, he texted me saying there is an accident in front of him, so he has to wait. But his lecture is not until 4 o'clock, so we'll be okay. So I know 50 minutes is really not enough to do a very deep analysis of anything, because we're hoping to give you time to also ask questions, but we'll try to be as succinct as possible, but give you the most important features of our presentations. So what I'd like to share with you today is what are the most important key concepts for treating chronic diseases. I should say one thing that homeopathic medicine is really pride itself off is the treatment of the chronic diseases. As you know, in conventional medicine, we're pretty good at infectious diseases because we can identify the cause. We know it's a parasite or a bacteria or a fungi, and develop a treatment to eliminate the malaria or tuberculosis. And we know how homeopathy is very effective also in the treatment of the acutes without using drugs. But one thing that the conventional medicine is very lacking is treating chronic diseases, because as soon as we talk about any chronic disease, we don't talk about the cause. We don't know what is the cause of the headache. We don't know what is the cause of pretty much anything. And most of the time when we tell people that this is the cause, or when we talk about cause, it's really important to recognize that cause is not universally defined. That means if I have a headache and I go to a nutritionist, a psychologist, a chiropractor, an acupuncturist, a homeopath, a naturopath, the psychologist, the neurologist, and ask them, I have a headache, what is the cause? It's very likely that I'm going to hear either we don't know what is the cause, or we're going to be given different ideas of what is really the cause. It's very normal. The psychologist would look at all the complex emotional issues that haven't been resolved in your life, and a nutritionist is going to look at your food sensitivities or allergies. And a chiropractor is going to look at the health of your spine, and an acupuncturist, the meridians of energies. So every profession has a definition of what is the cause based on that modality. So when it comes to homeopathy, then we ask ourselves, well, what is the cause? What is the homeopathic definition of the cause? And I think it's really important to recognize, and I mean, you're all homeopaths, I'm not telling you anything new, but we from a homeopathic perspective, because human being is just one organism, we have been created from one cell that developed to be everything that we are. And it's very logical to think that every single thing that is connected together. So when a patient presents with a headache and asthma and Parkinson, it's really important to recognize that the likelihood that all of those are an expression of a central disturbance is that many. So from that perspective, it's very important to recognize that cause is that one thing that is able to explain everything about the patient. That means even in homeopathic treatments, we often give a remedy that helps 2 or 3 symptoms of the patient. And we're very happy, but the remedy hasn't affected the totality of the person. That means we're only treating parts of the patient. We're not treating the totality. Now, the question is whether one remedy can cure the totality of the person. And I think that's a debate that has been going on for 200 years, yes? So I don't want to get too much to the complexities of it, but from a purely practical reason, it's important to recognize that human beings are made from whatever exists in nature. So life started with the Big Bang. Minerals came into existence. One cell organism were the first expression of life. Plants came into existence, animal came to existence, and then humans evolved on Earth. Therefore, when we look at any human being, there is a picture of an animal, a plant, a bacteria or virus or parasite or a mineral within the person. Human beings are extremely complex, and it's very hard to reduce a human being to one state. But when there is a pathology that hasn't been cured, really treated, it is important to recognize that when a patient is presenting to us, it's very likely that their totality is one state. Now, if they're taking drugs and they're having side effects from the drugs, it's an artificial disease that is put on them. But that totality is one state. And if you can perceive that totality and go after that, miracles happen. And perceiving that totality means knowing the patients in depth. You have to know everything about a patient. You know, my own evolution in homeopathy started with being a medical doctor, telling myself if I don't know how to cure a headache, I know how to treat a headache, but I knew that if my professor of 30 years of experience in neurology cannot cure a headache, then I will never be able to cure it. And if I cannot cure a headache, then I cannot cure a cancer, I cannot cure any other diseases. So I had to learn first how to treat simple diseases before I can learn how to treat chronic diseases. Within 6 months of practicing homeopathy and naturopathy together, I realized I have a couple of patients in my practice who suffer from asthma all their life or headaches all their lives. And when I give them the remedy, the right remedy, the asthma disappeared. And that's when I told myself, well, my intuition was right. If we know how to treat, if we go after the cause, we can cure any disease. But it wasn't until 7, 8 years later that I had a patient who came in for bladder cancer. And he had driven all the way from Waterloo to Ottawa. I did a 2-hour consultation with him, and I had 6 or 7 remedies in my mind, and I really didn't know which one to give him. I encouraged him to stay overnight, and I saw him on, it was a Friday evening. I saw him next morning for 3 hours. At the end of the 5-hour consultation, it was very clear to me that he needed orum muriaticum nitronatum. I prescribed the remedy in 12C, 30C, and 200, and I asked him to start with the 12C. So he had the bladder cancer for 3 years, and he has been treated for 3 years with conventional medicine, and it keeps returning. He was bleeding from his bladder, and they're going to remove his bladder and replace it with remove a part of the colon to make a bladder, remove the prostate. He was 51 years old. So it really was important for me. I said, I cannot waste time finding the right remedy. It's better to go as deep as I can and find the remedy. Within 3 days of taking oral muriaticum nitronatum 12C, the bleeding in the bladder had stopped. By the end of the month, he had no symptoms at all. 2 months later, when he went for his pre-op, they told him that there is no trace of cancer in his system. So that that case was the beginning of transformation within myself. And I told myself, well, why don't I spend 5 hours with all my patients? Why do I limit myself to an hour and a half or 3? If it takes time to know a patient, then we have to take time to know our patients. But except when you deal with the cancer patient is very eager to spend 5 hours with you because they're willing to spend 7 hours going through surgery. But when someone has a simple headache, they may not want to spend 5 hours identifying the. But I think it is one of the most important key concepts of treating chronic diseases is to educate your patients. It's very important that for a patient who comes and say, I just have a simple asthma or I have a simple headache, because they think it's a simple headache, that it is a simple headache. I could say that the treatment of a headache is as difficult as treating the cancer if you don't have the right remedy. So and sometimes when you have many symptoms, it's much easier to zoom to the remedy and find the remedies. When you have only 1 or 2 symptoms, it may be so many remedies that you need to identify the right remedy from. So the most important thing is education of your patients from the very beginning. It doesn't matter if they come to you for allergies, if you're running a constitutional homeopathic clinic. I'm not talking about an acute care clinic. To educate the patients that it doesn't matter how simple your symptom is, the cause is very hidden. And in order to identify the cause, you need to know everything about the patient. So the other thing is really important is to recognize that the disease is a wrong or maladjusted expression of our survival mechanism. Jeremy Sher used to say, disease is the right thing in the wrong place. He says, if you look at a sand on the beach, it's perfect there, but if you have a sand in your engine, it's going to cause a lot of trouble. So disease is the wrong posture or right posture at the wrong place. That means a trauma has happened either on our own lifetime or a trauma has happened to our parents or grandparents. We do know the miasmatic tendencies, predispositions we're born with. So trauma is not only us, it's our whole life. When a trauma happens, the body goes into survival mode. And that survival mode is an out-of-proportional reaction to everything that happens around us. So if a person has allergies, it's because they're overreacting to their environment. If a person has panic attack, they're overreacting to their environment. The same thing is true when they have Parkinson's, when they have cancer. It's an overreaction to a situation. But that reaction was perfect when the trauma happened. So at the time of the trauma, it's very important to have a reaction to survive. But once you go to that survival mode and stay in that survival mode for the rest of your life, then that's when the problem begins. So what we really are doing in the homeopathic case taking is to identify what are the survival modes of the patient. What is happening from head to toe. So it's very important to go through the body and what is happening at the mental, emotional level. That means from their childhood until today. And what is happening at the cognitive level, that's the mental, sorry. And then what are their existential issues? That's a concept that is always looked over in consultations, I would say that a lot of people have existential or spiritual crisis in their life. And what I mean by that is the crisis of meaning, of purpose, of identity, self, who am I? What is the purpose of life? What is happening to me? Why is this happening to me? So if you can identify how this aspect of the patient expresses itself at their mental, emotional level, and how does it expresses itself at the physical level, and you can bring them all together into one state, and you prescribe for that, then you will be able to cure pretty much anything. Except when you don't have enough time to cure. That means when the person is a terminal patients, you don't have time to work with them most of the time. But it doesn't mean homeopathy is not effective for terminal cases. In a few years after I had that cancer patients, I received a stage 4 ovarian cancer. She has been treated homeopathically by given like Paganum, orum, few other remedies. I did the same thing with her. I spent a few hours with her, went to the very core of her, and decided to give her wolf milk, like lupinum. So the homeopath was good enough to recognize that this is a milk, but because lactanum is the best known milk remedy, we have given lactanum. But once I gave her the lupinum, she went through a healing crisis within the 24 hours, which is very often when you do a case. And I'm going to be showing you a case today of what this healing crisis looks like. I'm sure you have seen many of those. And then in her group, she had started already the chemotherapy. When I treated her and gave her lupinum, within 45 days, she went for the surgery, and the doctor says, I think we misdiagnosed you. You don't look like having a stage 4 cancer. Your cancer is so small and shrink. So out of 47 people in her stage 4 that they were meeting on a regular basis, she was the only survivor. And 2 years later, her symptoms returned. I gave her lupinum again, and it disappeared. And now this is 15 years ago, so she has passed the 5 years and longer than 15 years, really. It was in the 2007 or 8. So, but the power of the precision, if you need lupinum, giving lactanum is going to help you a bit. It's not going to cure you. You have to find the perfect remedy that matches the totality of the person. But I could also tell you that another important thing is when you treat chronic diseases, anytime you give an animal remedy, you have to be sure that once this animal survival mode goes away, very likely you will see either a plant prescription or a nasal prescription or a mineral prescription. And the human being is going to go from a very complex defense mechanism to a more simple defense mechanism, because life has become more and more and more complex. But that doesn't mean you always start with an animal remedy. You have to recognize what is the remedy of the person on that state. I would say a person who is in a mineral state very likely will need a nozo before whatever they have inherited. So it's very important to pay attention to nozos once you start treating the chronic diseases. And then for their acutes, they will need a plant remedy, and once in a while they may need that animal remedy. But those remedies are not for their chronic state. So first identifying what is the state of the person, what is it that needs to be, what is that one state that explains the totality. You go after that, and then as symptoms come during the acute situations, you follow it. The body will guide you to the right nozo, or to the right mineral, or to the right plant. So I have to be careful of time. So the challenges we have is some of the remedies are really well proved. We have thousands of symptoms for, and some of the symptoms are not really very accurate symptoms either. Some of the remedies are overrepresented in our material, in our repertoire. And then there's many remedies that are not well proven, and we know very little. Some remedies we know a lot more from the emotional perspective. And other remedies, we have only few key symptoms on their physical level. So we have to have that awareness not to rely only on repertorization, especially if you look at repertorization and definition of totality is that remedy that covers the majority of the symptoms. So this is not about what the repertory tells you covers the majority. It's about what is it that is covering the majority, because it can be that a small remedy that hasn't been proven enough. So we don't know all the physical symptoms, but we may know one or two key symptoms at the physical level, or one or two key symptoms at the mental, emotional level. The case I'm going to present to you today is a case of a raw remedy. This is a patient that we saw with a group of homeopaths. There are around 25 homeopaths and myself. We got together a year ago in this course called Road to Clinical Mastery. We met once a month. I would see a patient that has been treated homeopathically before, like somebody with chronic disease, and some of them, the chronic diseases was a lot more advanced than others. And start the case in the morning, spend a couple of hours with the patient in the morning, ask the patient to come back in the afternoon for 2 to 3 hours, again, if needed, and look at the totality of the case and make a prescription. So the case, so we saw 11 cases during those 12 months. The last session was only to do follow-up. We didn't accept a new patient. And it's really beautiful to see how powerful homeopathy is, because almost all of them have responded really nicely to the remedy. Except, well, one patient responded so strongly that she decided not to follow homeopathy. That was the, another patient took 3 remedies before we found what is the right remedy for her. But everybody else has improved really well. But the case I'm showing you today for me was the most significant cure, because the traumas she had in her life was unimaginable, and the severity of the pain that she had. In one of her follow-up, she says, my pain was 200 out of 100. So this is like beyond any pain you can describe. And then after the remedy, she said, "Oh, it's all the severity of the pain is gone." And please.
Good morning.
Welcome.
Sorry, we are late.
No problem at all. Please, please join. Make yourself comfortable.
Good morning, everyone.
Hi.
Good morning, sir.
Good morning. Good morning. Sorry.
Good morning, everyone.
Sorry, we were late.
That's all right. That's all right. Welcome. Welcome. So for those of you who are online, we have a group of our guests that arrived from United Kingdom, and they were stuck in traffic. They just made it here. So welcome to everybody. Sorry, we had to start on time because of having many speakers and a tight schedule. So it's also important to recognize that each kingdom is really unique in the way it expresses itself. And that expression, that means if a person is in a lakhs state, it's going to create a very different energy in this person that if you need an intramariatic mineral, or if you need. Now, in some of my previous lectures, I have talked about, and you will know how to make this the key differentiation between recognizing the kingdoms, especially for your initial visit. It would be important if you could do that.
Oh, sorry.
So this means not only we need to know the patients in depth, we also have to know the remedies in depth. Because if you have a very superficial knowledge of a remedy, it doesn't matter how well you don't know the patient, you won't be able to match the patient to a remedy. But I do believe that what has helped me the most to recognize remedies is to spend those 4 or 5 hours with as many patients as possible. So that means it doesn't matter how much you think you know lycopodium. You will have patients who come in, you think it is lycopodium, you give it and it doesn't work. Or patients who come and looks like something else, and 5 sessions later you realize, oh, this is a simple case of lycopodium. That means every remedy has many different presentations. It has an essence, but it has many pictures. And the more pictures you familiarize yourself with, the easier you can recognize the remedy. So if you want to know lycopodium well, when a patient comes and you gave lycopodium and they did really well, then try to know the patient the best you can. Just go through their childhood, find out what were their biggest challenges, how did they express themselves in different ways, find out what is the essence of, what's the picture of this picture in this lycopodium, and do that with everything else. But you know, the more I have done that, the more I have spent 4 or 5 hours with the patients, the more I realize the vast majority of the polypress are not used as much as all the other remedies. That means, in my mind, everything is a polypress. Everything can have a very deep reaction in a person. So the other thing that I inform my patient of is the fact that because we evolved from nature, it just makes sense to recognize that when something is not functioning at our DNA level, it's makes more sense to go to nature and find something that can prepare it or heal it. So this is why homeopathy is the most powerful medicine available, because it's the only science that uses mineral kingdom, the one-cell organisms, the plants and the animals. I don't think there is any other medicine out there that is using as many varieties of substances in nature as we do. Homeopaths are using wolf's milk at present. And if we don't use it, we won't cure those cancers that I talked about. We use not only gold, but many salts of gold. So homeopathy is unique in that features to recognize that there is always a state and there is something in nature that explains that totality. So finding that the state requires going as deep as you can with every single patient. That is my most common practice is I see a patient for an hour and a half, and 90% of those come again for the 3-hour consultations. And that an hour and a half is to really eliminate a very simple case of pulsatilla or sulfur or glycoprotein, because I may not need to go as deep. But if the patient wants to go deep, I'll go as deep as possible with them. And it allows me to recognize the remedies at a deeper level. I think I wanted to share with you just a few minutes of this video.
Something that's like a hard back will trigger my neck. There must be a trigger point in the shoulder somewhere.
Not the names, but the actual experiences within your body.
So fun.
Tremors. I shake and tremor. They told me that I had early onset Parkinson's about 6 or 7 years ago now. And so I shake, I tremor. I'm in a lot of pain with my neck. I grind my teeth in my sleep. So I get a lot of, there's times that like even getting up, walking around and doing life takes everything out of me because the pressure is gone, almost gone when I'm laying down. Like the spasming stops or goes almost to nothing. When I stand up, like the pressure, like the compression of being upright, even sitting here, like my neck is starting to hurt already. I don't know if you can see it in the picture, but I'm turned slightly to the left. So I've got no rotation to the right. So there's a lot of stiffness, a lot of aching going on, almost no mobility to my neck. So that
I just want to, for the sake of time, I wanted to give you an impression of the patient. So that's what she looks like. She said that since I have what they call crushed disc, cervical disc 456. And so they used me as a guinea pig and injected me with Botox. It affected my neck, shoulder, my ability is much worse. They told me this was supposed to help me, but I found out this was just poison they put in my body. Since I'm a seer on an spiritual level, my friend told me that I'm cursed when I was in my mother's womb. Someone said I'm bound at my neck. There is a demonic curse on me. I got skull crushing headaches that are so severe that they level me to the ground. It is so debilitating. So she had some neurological issues, autonomic dysfunction. She had 2 brain tumors, cavernous cavernomas, in the backside of her right ear. And they have been there since birth. The other one above her left eye is straight up the bridge of the nose due to a direct hit to her head. So I asked her to go through every experience of the pain and describe what does actually, what is it that she's calling. She says the pain is crushing, throbbing, stabbing, burning, nerve pain, electric shock, like you put your finger in a socket. That was the intensity of the pain. The enemy uses my pain level, and it just came out of her, against me a lot. It debilitates me. On an emotional level, I also need help. A lot of the stuff need to be brought to the surface. Abandonment, rejection has plagued me. So I asked her to describe crush. I said, tell me about crush. It's a word that she has used a few times in her description. This is a very summary of almost 4 hours of consultation, or 3 hours. I think we didn't spend that much time on her. She said, crush is not being whole. It's pain, broken-hearted, sad, desperately wanting to be whole, crushed in the spirit, and comfortable. So I asked her to tell me, describe not whole, because not whole means different things to different people. You don't know what she's really talking about. She says separated, divided. Body is screaming at me inside for help. I asked her to describe. So she uses a word. I just use the same word to just understand a bit deeper. So she said she used the word separated. She says not together, left alone, wanting to be healed, loved, accepted, abandoned, forgotten about. Don't exist. Tears, hard to breathe, or maybe tears. I actually don't know which one. Maybe she was being tearful. I asked myself why. Then comes the physical pain. So I asked her to describe a bit more this separated or divided. She said, alone, again, forgotten. You know, I'm asking her about the physical symptoms. She's telling me her whole life story within that physical symptom. So whether you like it or not, this is the source of her pain. You're already by going through her physical symptoms, you're seeing the emotion and the spiritual component. Don't want to be alone, lost, fear, numb, all the neurological issues, as well as her dissociation, because when you have a lot of pain, the easiest way is to become numb. Anger, forgiveness. And right, sometimes disrespect. So I asked her to clear her mind now and not to think of herself, just to talk about divided or separated. I said, let your soul connect to that energy and tell me what comes. And then I asked her to draw it. I said, actually, I want you to take a piece of paper and draw it for me. She was on Zoom, so she did that drawing of a heart that is broken in half. So we could say that, oh, this is just a simple case of heartbreak. How many people talk about heartbreak? Is this a heartbreak, or is this something much deeper into it? Definitely there is heartbreak. When the patients use the word, their mind goes to a heart that is broken as opposed to something else that is broken. But you can clearly see that this is something that is separated at the core, at the very center. This is the expression of who she is and everything that is about. So I told her, always encourage the patient, you did really well. Do the same thing with the stabbing, because you have to do it with different words, see what comes up. This is pain, poked, a stab, knife, hate. So hatred is a very big word in her. The emotions come with the physical sense, sadness, surprise, sharp. And then I asked her to do the same thing with burning. She said fire, pain, ouch, help, desperate, hot sensation, discomfort. And I asked her, fire and hot together, what comes to you? She said, water, help, save me. So the person who is in desperate need to be helped and saved. So the question is what to do with that information. So if this was the presentation, we would think, well, let's ask all kinds of questions about everything else. But I want to show you, if you really pay attention to the core and understand the remedies at their very core, you could actually make a prescription already for the patient. And that's the. So I asked her about any memories related to fire, and she talked about the curling iron, that when she was young and it burned her forehead. She talked about her brother that dislocated her shoulder and then broke her shoulder. So broke and dislocation, which is separation, comes out, those memories. I asked her about shock or shocked. She said fear, surprised, ouch, pain, being surprised. And then I asked her, sorry, I'm going through so fast again because I'm aware of the time. Says the whole energy of quick, unexpected, and it is done. She said, surprise, unexpected. Here we go again. That's what comes. Something surprising, unexpected, and here we go again. And I asked her to give me the earliest memory she has of this state. Here we go again. Something is happening. And then she goes and talks about her childhood. So you take the person to their physical, to go very deep in their physical, and then you ask them, how does it connect with part of their life, and see what comes up. So whatever comes up is connected to that totality. It's like, you think of a tree, symptoms are the tip of the branch, you go very deep. And then as they go to the trunk, it's going to connect to another branch and then to another branch. So where you see that place where everything connects, you're at the trunk. And if you can prescribe a remedy for the trunk, you don't need to treat every branch with a separate remedy. This is the idea of the cure. So she talks about all the abuses that she has gone through physically, mentally, emotionally, sexually. And cops being called at home. I'm going to go through this, the feeling of being petrified, of being very sick. Parents wouldn't come to visit her in the hospital, or having pneumonia. She had to leave window open so she can breathe. And her parents would go outside under her window and smoke. And they didn't care about her distress. And then she talks about the curse, the idea of being cursed, as she said, she believes that she has been cursed from birth. That's how her life. There is demonic, and she says it's not just about me, it's in the bloodline, it goes to many generations, pure evil. And demonic, Satan, not the Holy Spirit, not God, not Jesus, pain, hatred. And then she talks about division, separation, abandonment. And as she's talking about the demonic. So there is obviously a separation within her of a side of her that is a seer, that is like a prophet that can, in the dreams, connect to things. And then there is this other side. And then she talks about this separation within her. So what is the most common remedy we prescribe when there is a division in a person and there is the angel, the good angel and the bad angel? Anacardium. Yes, it comes very clearly to our mind, except this is not an anacardium patient, because we have seen anacardiums. This is too much for it to be an anacardium case. An anacardium belongs to the anacardiaceae. The restlessness is so strongly known for that remedy. It's because the state of anacardium is to be stuck in a situation, feel trapped, and they're not able to move forward. That's why they need to always be in the move. None of those comes out when I go to. But this is about division. It's about that heart. You want to remedy that does that. So anacardium present that, but the family of anacardiaceae is not about this. And I asked her to talk about these two sides. She says blessing and curse at the same time. Should be able to pray and hear from God is the most beautiful experience. On the flip side, it's very scary to see some of the things I see. Sometimes I get confused what I hear and see and what is real or not. So the remedy I gave her was from the Malvale family. The core of that remedy is about being attached and then detached. Malvale or Malvalide family. Binding, bound, connected, disconnected. Linked, put together, union, emotion, communicative, unattached, separated, indifferent, disjointed, apathetic, and sympathetic. These are the keywords of that whole family. On your own, so abandonment is part of this. Self-sufficient, self-reliant, self-confident is the compensation, because you have to rely on yourself when you're abandoned. and then tied and connected, united, break up, coming apart, merge with, not together, splitting apart. So there is very likely that many times we have given anacardium to the patient because we saw that division. Nausea is another remedy for when there is a split in the person between their morality and their sexuality. And so the differential diagnosis of the Malvale family are the leguminose. Most legumes, like the pea, they split in two also. Malvale is the chocolate bean. That's that family. The cola nut is in that family. What is common between the conifers have a feeling of broken because they feel extremely fragile, and the scrophulariaceae that have a feeling of being separated and not connected together. So we need to make a differentiation, but once you go through the core feeling of each one, you recognize that this is a strongly something that has to do with the group of the families that are together, but they're separated. And that anything that looks like the bean has this. So the remedy I gave her is Paganum harmada. As you know, it's a remedy that is new to the homeopathic community. I'm sure in India they use Paganum harmala very often because it's something that is used in traditional culture to chase away the evil eye, the evil spirit. And it came out in the proving of the Paganum harmala. The proving was done in Russia. So that's it is known as a sfand or a sfand in Persian. In most Persian-speaking countries, they use it in the weddings to make sure nobody put an evil eye on you. Anybody who travels, we burn a sfand after them in order for them to be safe. We do it when the person becomes pregnant and they're giving birth, but that substance traditionally has been known very strongly to chase away the evil spirit. So these are the seeds, and this is the pod. All the seeds are contained together in here. They're together in this, but they're very separated, and they have very sharp. But we burn them also in order to, people inhale the smoke of it in order to chase this. So this is the substance. It looks like this on the tree. And I'm going to show you a very short follow-up. No, unfortunately, time has.
I took it at like 8:30 that night. Didn't really notice any difference that night. But at nighttime, I slept the best I've ever slept in my 48 years. I slept all night. Normally, I'm up 4 to 6 times a night, either getting a drink, going to the bathroom, hot and cold chills, that kind of thing. But I slept great. Now, the day after I took it, that was the best day of my life. I was bug-eyed, wide awake. I mean, I was highly alert. I had absolutely no pain. I was energetic. I felt vibrant. I felt like I was a teenager. I felt great. That Monday rolls around, and it was like the death of me. It was like the pain come back 100 times worse. I had a skull-crushing headache.
So when a person says that I slept the best of my life, that means I needed your extremity 40 years. When someone says the pain disappeared, or for as long as that they had the pain, they needed the extremity. So this is a remedy that's going really to the core of her and is removing all of this. So you go through this piece, you sleep really well, you feel amazing next day. But it's impossible to cure a chronic disease overnight. The body wants to cure it, the mind wants to cure it, but the body is going to go through a ringer before you do that. So I know we're short of time. I want to make sure I leave a bit of time for questioning, but she goes on to describe how every pain that she had came out on the second day. So 2 days after taking the remedy, and it was 100 times worse than ever. And it lasted for 2 days or so. The homeopath who is taking care of her asked me what to do. I said, give her a sack-like don't give any remedy, don't interfere with it, she wanted to antidote it. She told the patient, I'm going to antidote it, but she just gave a sac life to the patient. Gradually improved. In that her first follow-up, she was so much better already. She just took the remedy one time, and that was 3 weeks later. She didn't need to repeat the remedy. The neurological pain almost disappeared, the skull crushing. The second follow-up I did with her, she didn't have the headache anymore. 95% of her headaches are completely gone. She doesn't get any jolts in her body, any shocks, any nerve pain in her body anymore. But the most beautiful thing, she says, there is such a peace inside me. I feel like it's all love. So the hatred, the division, the separation, she says, as if I become one. And I operate out of love. I feel like God sent you, and my homeopath referred me to you, in order to heal the curse that has been there all her life. So this means it doesn't matter how severe is a pathology, understanding the core and understanding what needs to be cured, the body can do amazing things with it. The reason I said this out of that case, this is the best, is because she was in most emotional, spiritual pain and physical pain than all of the other patients that I have seen. So I think at the end of that 12-month session, I told my students, if that whole thing was for this lady to feel better, because she's in hell all the time, it was worth it, everything that we have done together. So I was so happy to see her radiant and laughing. Unfortunately, I don't have time to show you the other follow-ups, but she has reacted extremely well to the remedy. So a couple of minutes out of my time. I know you all need a bit of a break, but I could take one or two. A 30C originally, yes. And then when we did a follow-up with her, I asked the homeopath to give her LM1 if she relapses. But I think she couldn't find LM1. She gave a 6C, and she said, oh, 6C has no effect on me. She took another. Anytime the headache would come or the jolt would come, she would take another dose of a 30C, and it would work always like magic for her. So she's only at the 30C for now, but she will need higher potencies. And I do know at some point we will need to give her a nosode, and at some point we would need to give her a mineral remedy. And I say that because I have done this for 30 years. You heal a state, but as soon as you heal a state, another state is going to come. It's a much healthier state, but it still is a state. I'm going to give you a very fast anecdote. I've shared this with my students, so I apologize for those of you who have heard this. Around 30 years ago, I went to a seminar by Henny Mast. She's a homeopath from Netherlands. She showed a video of a child who was so restless, moving around the consultation room, not connecting to the mother at all, ignoring mother and ignoring the homeopath, and not answering any questions. So the whole consultation was done with the mother and the homeopath. But the camera would show how the child is just really indifferent to everything. She prescribed mercurius to this patient, did the miasmatic work, and showed how it's a syphilitic state. Mercurius worked beautifully. She showed a follow-up a few weeks later. The child was completely out of that state, sitting in mother's lap, hugging and kissing the mother, and connecting with the homeopath. So it's a transformation in that. And Henny asked, what would you do now? And I thought I was naive. It was the beginning of my homeopathic things, but now I know I wasn't. I said I would give him pulsatilla because he's in a pulsatilla state, and everybody laughed. And she said, well, this is the healthiest state. You don't need to treat that. So you just, but then she did short follow-up. 7 months later, this child had a very severe pneumonia, and pulsatilla took her out of the state. So this also shows that even when you give a mineral, wait for an acute, and the acute will need a remedy that's related to the new state that is healed. So do you heal from a pulsatilla? Yes, but once it is healed, there has to be another state. It's a much healthier state for you. Just have to find out what is the new state and go after that. But at any given time, there is one state that is predominant in a patient. Usually people don't come out of it that fast, but this case of mercurius taught me that yes, you can bring a patient out of a mercurius state within 2 weeks, but you bring them to a much healthier state. The question is, have we given pulsatilla after 3 weeks? Would he have a pneumonia? I like to believe no, he wouldn't. That would be the prevention of the pneumonia. So that was another teaching lesson. So because of time limit, we're going to take a 5-minute break and we'll come back and we'll continue. We have many wonderful presenters, so I'm sure you all need a short break, but thank you so much for all your attention. So I'd like to introduce you to our next guest lecturer. We have the privilege of having Dr. Nanda Kumar with us. He's a very popular homeopath from South India. He has presented scientific papers in many national and international seminars and conferences around the world.
Can you speak a little bit louder? We have a very tough time to hear you.
Okay, I'll try. Thank you. He's a very prominent personality in South India, regarded by his senior colleagues for his dedication and hard work. He has excelled throughout his career as a student, physician, and a teacher, an eminent practitioner, and a blessed personality. Dr. Nanda Kumar is a progressive doctor who believes in the integration of all medical system for the betterment of mankind. So I rather than going through all the qualifications, I'm sure you will see, once you see the quality of his presentation, you'll get to know who he is. We'll be sharing this with everybody who is in the online or in person, so you get the full credential. But without further ado, I'd like to invite you to join me in welcoming Dr. Nanda Kumar.
Good morning, everybody.
Good morning.
It's a great privilege to be here in Canada and get associated with the Canadian College of Homeopathy. And it's the first time I am in Canada.
Welcome.
Many times to US and other states nearby, but I took this as a great opportunity to visit these great countries. And thank you, Dr. Sharon, and my beloved mentor, Dr. Sharma sir. We have been associated for so many years. I've been working as a guide and faculty to Hahnemann's College of Homeopathy, London, for the past more than 10 years. So I'm privileged to get so much of encouragement from the principal of our prestigious college, Hahnemann's College, Sharma sir, and today also. He informed me about such a seminar being conducted here. And actually, I was planning to be here in Canada because I am also an invited speaker for the World Women's Health Conference by WHO, which is to be, it is scheduled on 15th, 16th, and 17th of May at Hotel Crown Plaza near the airport. So I'm an invited speaker. So I was preparing something that it has been programmed in the 2022 June, July. That was the period. So I was preparing something very scientific for that, because I was the only homeopath invited for that around the world. So when I present something in that forum, it has to be very scientific, and I should be able to give a very clear-cut scientific explanation about how homeopathy works. The philosophy, the organon, and all other things confined to homeopathy, we can discuss inside these four walls. But when you go out in the scientific forum, I think we should explain it in a different dimension, relating the latest investigations, the physiology, the anatomy, and what the world says is true and science. So we have to relate. And many of us have faced the skeptic criticism of homeopathy, towards the homeopathy, from different sources, that we believe in philosophy and we doesn't have a scientific fact. But this is not true. Many times we never relate our homeopathic knowledge to the scientific knowledge. We stand up different. We stand apart without relating to the scientific knowledge. We relate always ourselves with the philosophy only. But if a medicine works in a particular pathology, in a particular patient, whether you prescribe on the basis of holistic totality, on the basis of miasm, on the basis of mental generals, on the basis of physical generals, if it is working and if it is curing and if it is resolving the pathology and bringing back the cells into a normalcy, there should be a scientific explanation for it, which you can explain in the language of the science. We may not do that because we have our own philosophical explanation. But if a cure happens, there should be a scientific explanation. Now here, what I am going to emphasize is a clear-cut scientific explanation of the researches and the biochemical and phytochemical analysis of homeopathic remedies done. And the researches done in a double-blind method. You know how the researches are done. We do it in the proving sessions, but scientifically we divide a group of patients into 2 sessions and we give a protocol, maybe one drug, maybe few doses, maybe continuous medication for a certain group, and for the other group, the same is repeated as placebo. So after a certain period, there's a period of study will be there, and after that period, the investigations are done to check the percentage of success. That's called double-blind method, and all the allopathic drugs are being done like that to prove this, and they believe that that's the scientific. But when we individualize, many times we not be able to give such a statistics in our provings or in our results. But nowadays, many in experiments and researches are done on this aspect of homeopathic drugs. Now, I compile everything together to present a very scientific thing to you. So, the subject is polycystic ovarian syndrome. Few years back, when you put a patient into, when you refer the patient for a ultrasound, they used to write polycystic ovarian disease. And now it's the nomenclature has changed. Now they say it's polycystic ovarian syndrome. So what's the difference between polycystic ovarian disease and polycystic ovarian syndrome? The polycystic pattern of the ovary without any hormonal changes is called polycystic ovarian disease. The ovaries change into a polycystic pattern, but there is no hormonal imbalance. The endocrinopathy has not happened. The girl is getting regular menses, no symptoms of PCOS. But when the hormonal imbalance happens and all the symptoms of PCOS are presented, that is called polycystic ovarian syndrome. Syndrome means a group of symptoms which affects different systems. So that is, I just want to give a small explanation about what's the difference between PCOS and PCOD. Nowadays, PCOD is not used, it's PCOS alone. And you can treat any disease. But nowadays, the patients are well versed and their knowledge about the disease is very good. When they come to you with a polycystic ovarian disease or polycystic ovarian syndrome, it's definite that they have done the research, they have done the investigations, they have met a gynec, he must have prescribed some drugs, but it's not working. And end of the day, as a last resort, they come to you for a solution. Before that, they must have read well about the disease and they know much about the disease. So, in your discussion, they will check whether you know what is the disease. Whether you give Pulsatla or Anacarium or Belladonna or Restox doesn't matter to them. and how it is cured also. But do you know what is polycystic ovary? They will check whether you understood what this is or not. So that is the significance or importance of knowing what's the disease in this current scenario. Earlier, this was different. A patient doesn't know anything about the disease. What the doctor says is the knowledge. But in some cases nowadays, the patient has a better knowledge than the doctor. But we being general physicians, we know everything a little. But the patient is too specialized because he can specialize because that is his disease and he wants to know the ultimate about the disease. So that is the scenario. So polycystic ovarian syndrome is most common endocrine disorder, and 5 to 10% of the women of reproductive age leading cause of that. This is the leading cause of female infertility. In India, it's a very common thing. In my clinical practice, being practicing for the past 30 years, I think I have treated more than 25,000 cases of PCOD.
Wow.
I have this much bundle of cured cases. I am presenting here 10 cases with before and after scans that I will show you later in the last slides. So before going into those aspects of homeopathy, we will be discussing a little more about the physiology, pathology, and the endocrinology of PCOS. Why? Because at the later session of this presentation, we will relate these endocrinological disorders to our medicines, to our material medica, and how it is being corrected after giving our drugs. So you might feel that I am going more deep into the physiology of the PCOS, but you will know that why I relate. Now, for the hallmark of PCOS is string of pearls or pearl necklace. The appearance of a ovary, you can see the figure there. So the ovary will be looking like that is small pearls being a cluster of pearls. And we will learn how it happens. So what is in ovarian or polycystic ovarian pattern? What happens? Functional ovarian hyperandrogenism, that is, the androgen level increases in polycystic ovary. Due to so many, there are two reasons mainly. One is hyperinsulinemia and with insulin resistance. So when the insulin level increases in the body, this will stimulate the production of androgen, more of androgen, which will lead to hyperandrogenism. That's one. The second is Steen-Leventhal syndrome. It is named after Steen and Leventhal. It's a PCOS syndrome only, polycystic ovarian syndrome, similar to PCOS, but you can see the symptoms. It is characterized by, again, hyperandrogenism, then hyperinsulinemia, central obesity. Central obesity means the patient will develop more fat deposit on the central part of the body, and also an ovulation. The ovulation will not take place in this case and leading to infertility. So this is Steen-Leventhal syndrome. It's PCOS only, but these doctors have put their own names into that. That's all. Then ovarian hypothecosis. Hypothecosis is I will explain to you what is hypothecosis and what happens in the ovary later in the slides, because that's a clear-cut explanation about the hormonal changes that is happening. The sclerotic ovarian syndrome. Now, what happens? The exact cause of PCOS is not known still now. The exact cause is not known. What leads to polycystic ovarian pattern? But one thing is, three things are being found. One is resistance to insulin. Then second is hormonal imbalance, and third is genetics. These three are the main causes. And as I said earlier, the hyperandrogenism. The androgen level in the body increases due to so many factors. One factor is increased insulin level. So what is the function of androgen? we always need a very optimum level of androgen for our functions in our body. So an optimum level of androgen promotes primordial follicle initiation in the ovary. But here, the androgen level is high. So what happens? It increased follicular recruitment happens. Again, if optimum level of androgen stimulate the preantral and antral follicular growth in the ovary. But in a PCOS patient, the androgen level is high, so it arrests the follicular development. Again, if the androgen level is optimum, it maintains the health of the follicle. But here it is high and it reduces the health of the follicle. And it optimizes the ovulatory process, and here ovulation is being arrested. And it promotes the oocyte in a normal level, but if it is high, it impairs the oocyte development. So these are the changes that happens when the androgen level is high. The androgen level is high due to high insulin level. The high insulin level leads to high androgen level, and this high androgen level leads to all these changes in the ovary, leading to polycystic ovarian syndrome. Now let us just take a look into the effect of insulin, resistance on insulin in polycystic ovarian syndrome. See, this is a small presentation where you can see how it works. This I can explain for another 2 hours about this, but I will abbreviate and tell you how it functions. See, from the due to genetics, due to obesity, and due to intrauterine androgen exposures, what happens? Increased gonadotrophic release hormone is released. It is increased gonadotrophic release hormones is released from the hypothalamus. From there, it goes into the anterior pituitary. And from the anterior pituitary, 2 things are liberated. One is follicle stimulating hormone and luteinizing hormone. So if the GnRH is high, what happens? Actually, the follicle stimulating hormone should be the one which is dominant. So if the frequency is normal, then FSH is being promoted. If it is irregular, and then what happens? LH is being promoted from the anterior pituitary. So the balance is lost, LH goes high, FSH goes low, and this LH through the circulation reaches the ovary, where the ovary has got LH receptors. The LH receptors receives the LH, luteinizing hormone, which is high in level than the FSH. Actually, we need FSH. So this receives, and what happens? That is where the previous slide you have seen one word, ovarian hypothecosis. Now I will tell you what is ovarian hypothecosis. Here, the increased luteinizing hormone level is being absorbed by the LH receptors of the ovary, and what happens? Clusters of luteinized thecal cells. Clusters of luteinized thecal cells in the ovarian stroma happens. And these slowly develops into small bubble-like follicles filled with fluid, and there the growth, the maturation of the follicle is arrested, and it develops into a PCOS. Yes. This is the simple physiology. This is the simple physiology. I can explain about all these things for another 1 hour, but you should keep in mind the main cause what? Insulin, increased insulin levels, increased insulin resistance, leading to increased secretion of gonadotrophic GnRH, then GnRH to the hypothalamus, from the GnRH from the hypothalamus to the anterior pituitary, releasing more of luteinizing hormone than FSH. That luteinizing hormone comes to the ovary and converts the ovarian stroma into polycystic ovarian pattern, arresting the maturation of follicle. Why I am emphasizing on this is that after a few slides, when it comes to the materia medica part, I am going to explain to you how homeopathic drug inhibits the excessive insulin level by mimicking the insulin and regulating the hormonal levels in the body and curing the PCOS. That's why I'm giving emphasis to this. Right? Okay, we'll go to the next slide. The time is not permitting me to explain. So another thing is that this is same thing. So there are so many other factors. The cholesterol also comes from the liver. It also increases the androgen. So along with this, obesity happens. And few things I would like to explain to you regarding obesity and PCOS. If you ask me what is the triad of PCOS, we all know amenorrhea, obesity, hypothyroidism. The symptoms are different. These are not the symptoms. Obesity, hypothyroidism, and amenorrhea, and need not be a hypothyroidic patient. Or even we can classify the PCOS into two. We have been always talking about obesity and PCOS. That is with insulin resistance. Whatever there, you can get so many patients who are lean, who doesn't have obesity, who doesn't have insulin resistance. They also develop. As I said earlier, that is only one among the cause. There are other causes also. Hereditary is there, as I said earlier. In the earlier slide, you can see the hereditary factors is there. Intrauterine androgen stimulating factors are there. So all these are another factors, but scientifically proved one common reason, and about 80% of the people suffering from PCOS, they have this hyperandrogenemia due to insulin resistance. So when you classify these people into two, one is without insulin resistance and one with insulin resistance. So what are the, from this slide, so obesity, insulin resistance, hyperandrogenesis. Obesity is the one most important reason. So whenever an obese young girls, so there are primary and second. In our clinic, what we face is that young girls of 16, 17, 18, 20, 21, they come, they are not married, but they suffer from amenorrhea. They are not getting regular menses. They are putting on weight. They come to us when we investigate, or they must have already been investigated as a case of PCOS. There it's more easy for us to treat because here it is that the primary infertility is not a cause. But when the same patient or another patient comes with the same problem, is already married, now this becomes two liabilities for us. Treating the disease and what is the demand of the patient? I want a child. So that is the difference between when you treat a patient with infertility and without in a young girl. So that's obesity. And obesity, you must have heard about bariatric surgeries, right? We all know about what is bariatric surgery. Nowadays, another procedure of a ballooning of the stomach that's being done for PCOS treatment. Why? How do it work? So you know that how a bariatric works. The greater curvature of the stomach, it secretes an enzyme-like thing called ghrelin. So this will always encourage you to eat. Come on, eat more, eat more, eat more. You must have seen so many videos with the person is 150, 200 pounds, still eating a lot of meat and heavy fatty things. The person knows that after if he eats more, he will put on more weight, and this is morbid obesity. But this is the ghrelin is the factor which stimulates the patient. So what they do, they will put a sleeve on the greater curvature of the stomach. Now the ghrelin secretion is being inhibited. So the weight reduces. How? Now that will promote another enzyme called GLP-1, which is from the small intestine. What the GLP does is that it will increase the insulin secretion, but it will inhibit insulin resistance. Just a small explanation just to tell you how weight reduction will help the patient to cure PCOS, or artificially or naturally. When you promote the GLP-1, the insulin resistance is removed. Now the hyperandrogenesis is reduced. The luteinizing hormone level reduces. Follicle stimulating hormone increases. And follicles mature, it ruptures, ovulation happens, fertility happens. Right? Okay. And second is insulin resistance, third is hyperandrogenemia, which I have explained to you. So that is, these are the immediate effects. Then comes to what? Hypertension, dyslipidemia, punctal fact, as I said, then plus all the inflammatory signs will be there. And in the long term, type 2 diabetes and cardiovascular disease. So this is the initial, acute and chronic effects of polycystic ovarian syndrome. Let me be fast. So the other symptoms, the excessive hair loss will be there, acne, dark patches. What are the dark patches usually seen around the neck, face in obese people? What is it called? Any idea, anybody? You must have seen so many photographs, black discoloration around the neck, especially on the back. It's called acanthosis nigricans. Yes. Acanthosis nigricans. Yes. So this is a common skin condition usually seen in obese patient, and it is specific to PCOS patient because of the insulin resistance. That condition is called acanthosis nigricans. Then second is irregular periods, difficulty to get pregnant, hirsutism. Hirsutism happens because androgen level increases, testosterone level increases, so the girl will develop hair growth. Remind the symptom, hair growth in young girls. When you select a remedy later, just remind the symptom. Why we give that drug? Because how that drug covers other symptoms of PCOS can be explained later. When you check the material medica, hair growth in young girls, Tuja is one drug. Why we give Tuja to PCOS? The explanation will be given later. Just to remind this symptom, that Tuja has got a specific symptom, that hair growth in young girls. The other drug is Oleum Jack or
Oleum Jack and yes.
Oleum Jack and Tuja, two main drugs. Okay. Somebody told Oleum Jack here. Okay. Again, the symptoms, trouble conceiving, infertility, mood changes, acne, fatigue, insulin resistance, high testosterone. I just want to repeat all these symptoms again and again because we are here to gain some knowledge. So if I tell 100 times or 10 times, it will be in your mind for some time. Okay. Again, I have put the same slides one after the another for you to remember. After that, now one more. Now we will go into some researches done. I have told you about one, that is the ghrelin and GLP. How the modern medicine regulate the ghrelin and GLP levels by surgical method called bariatric surgery and ballooning in PCOS. The other one is called leptin. You take an obese patient, there's a leptin, there's an enzyme called leptin also. Leptin, the action of leptin is almost like ghrelin only. A genetic disparity in the production of leptin, a product of the obesity gene, may lead to various endocrinopathies such as PCOS. The objective of this study was first to ascertain the incidence of PCOS using the gold standard, second to ascertain the genetic property of leptin, and third to evaluate the association between leptin and PCOS. The study was done in 154 samples of Tehran resident female twins were taken, and they included 48 pairs of monozygotic and 29 pairs of dizygotic twins of age 14 to 55 years. The clinical ultrasound and biochemical findings were used to diagnose PCOS, and the incidence of PCOS using biochemical and clinical features of 16.2%. Just want to let you know about the researches done on this aspects of PCOS. So the correlation coefficient between serum leptin levels of the monozygotic twins was found higher than that of the dizygotic twins. The serum level of leptin was similar between subjects with or without PCOS and irrespective of the zygosity. So it was conducted that the evidence of PCOS is high, concluded that the evidence of PCOS is high among twins and that leptin is likely to be genetically determined, although the effect of environmental factors cannot be detected. denied. This study will not find any association between the diagnosed PCOS and leptin level. However, the link between the two may lie with another entities such as eating disorder and or obesity. So study was done and they tried to relate leptin levels and PCOS, but scientifically they couldn't prove. But one thing is that obesity is a fact. And those factors which lead to obesity has been always we have been trying to relate. The science have been trying to relate that with the PCOS always. So they have when it comes to leptin, it has not been scientifically proved. Now we will go into the homeopathic research, homeopathic side of PCOS and how the studies are being done in homeopathy. One is by Dr. Alan V. Schmuckler. According to research carried out by Alan V. Schmuckler in 2008, 36 women suffering from polycystic ovarian syndrome and fitting the homeopathic remedy pulsatilla were given pulsatilla 6C. The potency was 6C and 4 hourly throughout the day for 2 weeks after the end of menstruation, and this was repeated for 4 consecutive cycles. At the end of the trial, 30 of the 36 women had completed disappearance of the symptoms of PCOS and the production of normal ovulation follicles, and a further 4 of the 36 became asymptomatic. So this is one study research which was done in the double-blind method, as we spoke, the different types of studies what we can do. In that, pulsatilla 6C, which was given immediately after menses, 4 hourly. That is nearly 4 doses or 3 doses every day for next 2 weeks. And this was repeated for 4 cycles. And personally, I have tried this and found very effective. You can also try that. I'll show you the results later. This is one result. Now, I'm going to tell you very important study of an homeopathic drug called Cinnamonium cassia. The study was found that Cinnamonium cassia has a stronger effect on blood sugar regulation. However, this may be more due to its insulin mimetic action rather than increasing insulin sensitivity, which is more beneficial to those with insulin resistance diseases such as PCOS and type 2 diabetes. And how the cinnamon acts? The cinnamon contains some polyphenolic compound called polysyanidins, type A polysyanidins, which are insulin mimetic. They will mimic the insulin in the body. When you give Cinnamonium cassia mother tincture, that will mimic the insulin in your body. And that effect, what happens? It inhibits certain enzymes in the intestinal tract. That all we have already discussed. What is the enzymes in the intestinal tract? And convert carbohydrates into glucose, reducing the glucose load from whatever you are eating. The chemical compound in the cinnamon, which is responsible for its insulin-like activity, is a water-soluble substance called methyl hydroxycalcone polymer, or MHCP. So this is an essentially identical action of insulin in the body. So insulin you can give for diabetes mellitus. Cinnamonium cassia mother tincture. If you want to reduce the blood sugar in a patient, use Cinnamonium cassia, which has got a very scientific explanation here, how it reduces the blood sugar. And another research, I don't want to associate this, but as a speaker, I would like to expose that. Cinnamonium is a wonderful drug which has been used by many homeopaths in India for cancers. Why? See, because in a cancer, what the cancer cell does is, the cancer cell wants to grow fast in the shortest time, the largest possible way, the most powerful way. So what is the main consumption of a cancer cell? Yes, sugar. The best thing to consume is sugar. That's why the patient becomes lean and a condition called cancerous cachexia. The patient is taking enough food, every day enough protein, meat, fat, etc. But the patient is becoming lean and lean. because all the essentials are being absorbed by the cancer cells. There also the same thing happens. This will cut the glucose supply to the cell. Right? That is how it acts on cancer cells. The same thing happens here also. So that's why I told in the beginning, we need to know about the physiology of what is happening in a disease. Then only we could clearly explain to all these skeptics, criticisms, that this is how homeopathic medicine acts. So this is again another slide, the same literature. And this, I think this we have already discussed about this. Now we will go into some drugs, some other drugs. Along with this protocol, nowadays researches are done on the basis of protocols. The protocol is like you can give one drug. You can give one drug, one dose. Or you can give one particular drug with change of potency. First 1 week 6, then next week 30, then 200, like that. Or else you can give a group of remedies, 1 or 2 or 3. That's called protocol. A group, 1 or 2 remedies together, and this is called protocol. And this protocol research also can be done. So nowadays in many diseases, a protocol-based researches are done. But whatever protocol-based researches you do and you get a protocol, you will get wonderful results. But a specific constitutional remedy will definitely add on a great advantage and speed up the process of cure in homeopathy. With no doubt about that. As doctor said, that individualistic prescription must be there, but that I cannot generalize. That you have to find yourself. From your angle, you may find graphitis, but from my angle, it may be lakhs. But any drug which works, which reverses the pathology, is an indicator. End of the day. We all prescribe for the very purpose of curing. So that particular drug should be prescribed along with the protocols. This one drug, single remedy, single dose, it is there in the books, but when it comes to heavy practice, treating 150 to 200 patients a day, I don't know how far it will be successful, or how can you go into the details of the patient. So now we have to keep a protocol. I strongly believe that in the modern era, we have to keep a protocol-based treatment in homeopathy so that we can expect more results for a particular disease, and we can pass it on to the next generation, and they also will get more results. If you have time, you can individualize, you can go into deep, you can go deep into the cases later on when you get time, or when let the patient take the medicine. When you get the time, you go deep into the disease, deep into the patient, study the patient, give the drug, but let this work. So one is anting route. We all know about the mental symptoms of the anting route, but selection of this potency in particular drug disease is also very important. As I said, if you give cinnamonium 30, it will not work in PCO. Why? Because it's a physiopathological action of the drug. So you have to give mother tincture. The same way, and pulsatilla 60 is found to be effective rather than more than the pulsatilla 30. If you take Dr. Banerjee's study on brain tumor, why Ruta 6? Why can't you give Ruta 30? It was done in Dr. Anderson Institute in Texas. It was Ruta 6, not Ruta 30, not Ruta 200. So for certain particular disease, certain particular potencies has to be given, and that is found to be effective from experience. And from experience, they do research, and they do from the research, they come into a inference that this particular potency is useful in this particular disease. And arginine nitricum again, and this is 7C, 3x to 7C is the best potency to be used in PCOS, anti-crude. If you find anti-crude and indicated drug, the potency is 3x to 7C. That's what I would like to emphasize here, nothing more. If you find the patient is an anti-crude patient, use this potency. And if you find the patient an arginine nitricum patient, use 3x to 9C. And 6C is a wonderful strength, potency, which you can use in any disease which has an advanced pathology. If you find the patient to be lakhs, if you find the patient to be graphitis, if you find the patient to be anacardium or auremet or lakhs or lycopodium, if the patient has come to you with an advanced pathological case, you start with 6C. My 30 years experience says that's the best potency which you can start with. It is dynamic as well as you will get a pathological reverse. So that's the advantage of 6C. Many scholars, many practitioners, established practitioners, I know whom I share my experience and they share their experience. They are all lovers of 6C potency. But many a times in the seminar, they don't have the dare to be wise. So I would like to be there to be wise that I tell the truth to you that this is my experience. So that if you want, you can use, you will get the result. Calcarea carb, the constitution I said. Calcarea carb is a typical constitution in a PCOS. Graphitis, calcarea carb. So when you get that particular constitution, again, I would like to emphasize on these potencies, 12x to 6C. 6C is the best. Again, 12x to 6C copy. See, what I try to emphasize here is the potency which is used very regularly by established practitioners and found to be effective in pathologically advanced polycystic ovarian syndrome. So this is a short look, which are the drugs. Cinnamonium, 15 drops TDS is the dosage. Tuja 6 BD, pulsatilla 6 twice, and cyclamen 30 is another drug. Here, I would like to give you an indication of cyclamen. Cyclamen, see what's the problem with when you come to the menstrual symptoms of polycystic ovarian syndrome. The menses doesn't happen, amenorrhea is there. Now, after 3 or 4 months, the girl will menstruate, the lady will menstruate, but it can be scanty, 1 or 2 drops. In such cases, cyclamen is the drug. And sometimes menometrage, there will be severe bleeding. And that can be divided into 2. The back card, you see better while walking. When the patient takes rest, it is more. It's a contraindicative symptom. Usually when a lady is bleeding, the patient should get a relief when she takes rest. But in magnesium carbonicum, it is the opposite. When she lies down, the bleeding is more. When she walks, it is less. So that's a very strong, uncommon, peculiar characteristic of magnesium carbonate, where you can blindly prescribe on that symptom alone because it is an bias. So kaliiodide is written, kaliiodide, I said, in 50% of the cases there will be hypothyroidism. So this is how we can differentiate between the usage of drugs. Now, some other new generation drugs which have been added recently into homeopathy, which can be used in any such endocrinopathies regarding ovaries in ladies. One is uferinum. It is indicated in menstrual condition associated with hormonal changes, weepy, depressed, apathetic with an aversion to noise approaching the menopause. Uferinum you can use in menopausal ladies. In menopausal syndrome, uferinum is a wonderful drug. What the allopaths usually do is they give hormone therapy. The same way you can give uferinum to a lady of 45, 50, 55 who is going through the phase of menopause, and definitely it will console the patient, feel better with the drug. And ovarian related symptom is that it's a good remedy for ovarian cyst also because of this hormonal imbalance. Another wonderful drug is folliculinum. It's a sarcode and it's also as a hormonal carcinosin. You can note down the symptoms, but I will tell you the prescription side of this. Many of you must be knowing Farooq J. Master. He was my teacher when I was doing my MD in Metro Medicare. So recently in a talk he said, not recently, maybe 3-4 years back, you give 1 dose of folliculinum and 1 dose of fluorinum, one in the morning and evening for 6 to 1 week. This will regulate the entire system. Entire hormonal imbalance will be cut. And I have used it in many patients and found to be very effective. 1 dose in the morning, fluorinum, and 1 dose of folliculinum in the evening for 7 days. He has done a study on that. So that's about folliculinum. Bovista. Another wonderful drug for PCOD. You can relate these symptoms of Bovista to PCOS and early menses, heavy menses. As I said, when it is candy, it is cyclamen. When it is profuse, it can be Bovista or magnesium carb. And the differentiating symptoms is that in case of intermenstrual bleeding, menses stops, comes again after 2 weeks. That is intermenstrual bleeding. And during menses, severe abdominal pain and cyst in the ovary and fallopian tube. So this is just relating the symptoms of polycystic ovary syndrome and our drugs with differentiating cardinal symptoms of the drug. Another one, Tuja. See, a research was done by Dr. AK Dwivedi and company in Germany. So they found that the estradiol and progesterone level is significantly increased while luteinizing hormones and testosterone levels are decreased after the usage of Tuja. They did a combination drugs because I am very much associated with the company. I use their medicines. So they have sent me the literature of the study. They made 2 medicines, R38 and 39. 38 for left-sided ovarian affection, right-sided ovarian affection, and 39 for left-sided ovarian affection with a combination of few drugs, and Tuja is there. But the individualistic research analysis of Tuja says it will decrease the level of estradiol, progesterone, and increase the level of progesterone and estradiol, and it will decrease the levels of luteinizing and testosterone. Now, in the initial phase of this session, we have discussed about the effect of luteinizing hormone and testosterone in PCOS. So this is how Tuja acts on the ovaries to cure polycystic ovarian syndrome. Right?
So what kind of potency is used here?
6C.
Even for the folliculinum and
Yeah.
Right.
Folliculinum is that's for this regular usage, 6C is the potency.
no,
But as I said, he 1 in the morning and 1 in the evening for 1 week. That is 31 though. 30.
that's 30.
30. I think we are running short. I will now I will Persatlan, Nitramure, and all these drugs. You please relate yourself, and I will show you some cured cases. The one you see in red is the scans which are taken before the treatment. You can see Mrs. Suma. She is 38 years old. She has many problems. She has an fundal intramural fibroid is there. Her endometrium is thickened, and she has bilateral polycystic ovary. And after nearly 7 months of medication, you can see that the fibroid is not there. Polycystic ovary is there. A small endometrial polyp is also there. And now this is after the treatment. You can see the Mrs. Suma. You can see there is the uterus and ovaries are absolutely normal. No fibroid. Endometrial thickness is normal. And there is no polycystic ovary. Number 1, what's the protocol? My protocol is this: pulse elastics, voice, BD, cinnamon, 10 to 15 drops BD, and I give calcarea floor also along with that, which is given twice. We have discussed about calcium, calcium, tuja, povista and all. Palladium, one drug I would like to specify that if you get any type of cyst in the ovaries on the right side, palladium is specific for right-sided ovarian diseases, palladium. Now the second case you can, Mrs. Deepa, this early adenomyosis of the ovary, of the uterus with polycystic ovary. And now the adenomyosis is cured. Now only polycystic ovary. Now even Deepa is free from both the maladies. Third one, you can see Mrs. Vishnupriya with polycystic ovary, and Vishnupriya is as a normal scan. Again, Ms. Amrita has got bilateral polycystic ovaries. Amrita is free from PCOS. So many also has bilateral polycystic ovary, and after treatment, it's a normal study. Najia has got bilateral polycystic ovary plus left renal calculus. Now, Najia, both good. No kidney stones and polycystic ovary. Anjana has got PCOS. Now, Anjana is normal. No PCOS. So, these are the totally cured cases. I have so many, more than 1,500 cases I have recorded with me in my clinic. So just want to tell you, friends, that we should think in a different dimension nowadays. We should respect Samuel Hahnemann for his vision. His theory is hypothesis. But one thing we should understand, we should use our logic also. If Dr. Hahnemann has used his logic in his time in 1780, 1790 or an early part of 18th century, and things has been explained the way the science was at that time. Because for every theory, there should be a reason. So it can be explained only nowadays. What we say, I will tell you in a small example. In 90s, vitamin E was given to all cardiac patients. It was a supplement. And when after 2000, they found that vitamin E is the most dangerous thing for the heart, and they stopped giving vitamin E. Now, no vitamin E for cardiac patients. So once you find that this is not good, this is wrong, we should be able to correct. We should correct it. Then only it becomes a science. Or we find it something better, something more easier. We should have that open mind to adopt it and use, because these are all for the betterment of the patient. Then only we will develop. And we should go in par with the knowledge of the science. We should be able to explain the philosophy, the method of prescription differs. Mine is different, doctors is different, Sharmaji's is different. That's the different. But as I said earlier, end of the day, you should be able to cure. There should be a comprehensive principle behind that. But relating the latest knowledge with our homeopathic medicines and our theories and philosophies, that will definitely help you to go ahead in a very different path, in a more scientific way, and a more acceptable way by the public and the scientific world. Thank you very much for the patience.
Thank you so much. That was so wonderful. Thank you. Thank you all. Thank you for this wonderful lecture. I think we're ready to welcome John. John Miller. I have a privilege of knowing him for close to 30 years. He was one of my supervisors, actually, when I was going through the naturopathic college. So, and we have attended a couple of seminars together. I remember we met in Boston once, going to Tegas seminar. So John is a graduate of Prince University, the Canadian College of Naturopathic Medicine, and the dynamic school of homeopathy that's run by Jeremy Sher. He has studied throughout the world with teachers like Dr. Andre Sain, Jeremy Sher, Dr. Vasilis Pegas, Dr. Rajan Sankaran, and other notable homeopaths. He has been in private practice in Peterborough since 1988. He is a board certified in both naturopathic and homeopathic medicine. Additionally, Dr. Miller has been a board member of the Council for Homeopathic Education and the Homeopathic Academy of Naturopathic Physicians, and spent 5 years on the preparatory board of the College of Homeopaths of Ontario before proclamation. So for those of you who are new to Ontario, homeopathy has been regulated in Ontario since 2004, and John has played a huge role in making the College of Homeopaths become functional and having highest standards. He has been a teacher at the Canadian College of Homeopathic Medicine from nearly beginning of its inception, and has done numerous online webinars for a while for Whole Health Now. He has a lot of really wonderful lectures recorded. Further, his experience includes field work and teaching for Homeopaths Without Border in Cuba, El Salvador, Honduras, and Guatemala, as well as presentation for Homeopaths Without Borders. The Ontario and Canadian Naturopathic Association, the Saskatchewan Association of Naturopaths, the Australian Homeopathic Association, and the National Center for Homeopathy. So I have the privilege of presenting you John Miller, and here is John and his presentation.
Thanks, Sharam. Hello, everybody, and thank you for inviting me, Sharam, to this first very exciting seminar. Excuse me, my voice is a little strained this morning, so I believe by the time we're done, we'll get back on track. I'm presenting a rather simple case this morning, but the reason is it's one of the cases along the way that taught me a great deal, and I was hoping maybe you could learn some of those lessons that I learned. And the remedy that came out of this case has become sort of one of my favorite wintertime remedies, because this is a case of a young little fella, little 5-year-old boy, who had a bad cough, and his bad cough started sort of in late fall and continued on sort of through to the spring. The symptoms, he says he's got cough, he coughs and he vomits, he coughs with mucus, he coughs to choking and gagging and retching. Often he'll grab at his throat when he's coughing, or at his upper chest when he's coughing. He's generally worse at night. His mother tells me that he's often up in the night coughing, and he becomes rather whiny and whimpery, like often what children will do. He doesn't get mad or upset, but he becomes very clingy and wants his mom, and et cetera, et cetera. When I ask him about his cough, he's able to tell me he doesn't like to talk very much about it, because when he talks about it, it makes him cough more. So again, we have this idea that there's something going on in the laryngeal area, something in the upper bronchi. At times he can cough enough that he can't get enough air and becomes slightly cyanotic, a little bit of blueness in the lips, a little bit of blueness in the face, partly of what worries the mother, considerable. Parents generally don't like to see their children turn blue. One of the interesting symptoms is, again, he can cough so hard that the tears come, and he waters, his eyes water. When we listen to his chest, we hear some sounds in the bronchial, sort of upper bronchial area. There's some gurgling, some bubbling. And he's able to tell me, one of the things that puzzled me in this case was he tells me that there are little skeletons crawling up inside me, he says. That's what makes him cough. Of course, the mother kind of downplays this commentary. Often I find that parents won't listen to children when they're telling silly things like skeletons crawling up inside of them. But for me, especially a child under the age of 5, they're able to tell you things from a child's point of view. It may not be an adult's perspective on the matter, but it's a child's perspective on the matter, and there's often a great deal of truth in what they're saying. And so I tend to pay particular attention, and I wanted to end up with a remedy that would help me understand what these little skeletons were that were crawling up inside. This for me was the sort of strange, rare, and peculiar thing in this case. There was questions about whether this was croup or kind of a modified version of whooping cough. Like many children we see these days, they're using a cellular version of, and they even with the vaccination, of course, the original vaccine created a number of problems. I have medical friends that wouldn't even take the vaccine for themselves because of the problems. The acellular version is a little less problematic, but there's still troubles with it. And just as a side note, I've often used pertussinum or DPT or DTaP in potencies in cases where I see these coughs, but this was not one of those cases. So one of the conditions, of course, we considered was croup, cough, the stridor, the hoarseness, the difficult breathing, the barking or seal-like cough that we often talk about, again, agitated by crying. This child wasn't really crying. He was more that it was just lacrimation. It wasn't a tearful weeping. Often this can be worse. Of course, it's often common to have fever, which this child did not express any fever. He did have some symptoms of coryza. He had a bit of a stuffy nose, but nothing major, and no postnasal drip, no catarrhal congestion in the eustachian tubes. When we checked his ears, again, they weren't very noteworthy. There was no indication of mucus in the middle ear, et cetera, et cetera. There was no indrawing in the chest. You could see him breathe, and there wasn't any retraction in the upper areas, suggesting that there was some constriction going on there. Although he did reach for his throat, it made me wonder about a bit of an epiglottitis or perhaps a tracheitis, because again, his hands would come into the upper area. And I threw this slide into you just for your own help, because this is a way to classify the severity of croup. And we see with this child that he does develop some cyanosis. So if it was a croup, would be a fairly severe croup. But again, the cyanosis was not each and every time the cough came on. It was just there on occasion, and this is what bothered me. As he would clear some of the mucus, either through coughing or through vomiting, the cyanotic aspect was minimal. It was maybe in the overall scheme of things 10%, 10-15% of the overall problem. He did not show the stridor. Again, typically up in the larynx, in the upper trachea. As the auscultation showed, most of the issue was down in the bronchi, about the level of the bifurcation, and again some rattling, of course, to make us think perhaps like a remedy like antimonium, but it was not. There was nothing else to confirm that. Anyway, so I put that little slide in just to help out. When we take a look at the possibilities for croup, this is a quick search through the Reference Works program, and as you can see, there's over 300 remedies. What I will tell you is the remedy that was prescribed for this child is in this collection, but you should note that you'll see the classic croup remedies of aconite, hepar, and spongia, the classic trilogy, hepar, aconite, hepar, and spongia, which is often a kind of a protocol in the treatment of croup, and often very, very effective. But again, he'd had this. I'll show you the remedies that he'd had along the way, and it had absolutely no effect on the child at all. The other option was some kind of a whooping cough. Some may perhaps a modified whooping cough, because as I said, he had vaccine. He had the DTaP, not the original DPT. And there was a diagnosis from the doctor of a 100-day cough. Now, I noticed lately when I see the kids that have come from the pediatrician, they don't use the term pertussis much anymore, and they don't use the term whooping cough. They will use the term 100-day cough, which is sort of a back way of saying that it is in fact whooping cough, but they don't want to say it's whooping cough because then the parents come up and say, well, the child's been vaccinated, how can it be whooping cough? And then we get into a big discussion about vaccinations and whooping cough and et cetera, et cetera. So it gets called a 100-day cough. And it, again, very characteristic for this child where this thing had been going on. Again, he doesn't have all of the characteristic symptoms, and those characteristic symptoms, of course, is the whoop. He has not the severity where there's broken bones or periods where he cannot breathe. Again, they're periodic, where there is a little cyanosis, but not excessive. The time between the infection and onset didn't match. This is one of the problems that bothered me, that the onset of the time was in the fall, and we couldn't correlate it to anything. He hadn't had a cold, he hadn't gotten wet, there was nothing going around the school, there was none of his little friends had had anything else, there was nothing that looked to suggest that it perhaps a whooping cough was involved. Again, the paroxysmal coughing, the fainting, which we did not see with this child, the urinary incontinence, which didn't happen. There was no fractures, no herniation, no pneumothorax, nothing. There was an anesmus. Excuse me, that should be let me just fix that. Post-tussive anesmus. He did vomit from coughing, but again, not each and every time. He had a bit of a runny nose, as I said earlier, but nothing major. He's not one of these typical children with constant nasal discharge running down them, where they're either rubbing it on their sleeve or wiping it on their suit jacket. It's not an allergic salute where you see them wiping it upwardly. None of those characteristic symptoms were there, and yet this child had this, technically a kind of 100-day cough. Again, if we look at the remedies, possibilities for pertussis, we can see hundreds. So the diagnostic, again, of whooping cough is not particularly helpful to solving the problem, although I will comment, again, like with the croup, the remedy that was prescribed for this child is in this list of some odd remedies. Again, we see our remedy Drosera, which is our typical whooping cough remedy, and the child had Drosera by the time I'd seen him. Here's DPT relating to the vaccine, related to the possibility that it is a kind of a whooping cough, but the vaccine modifies its course. It tends to be less severe. But again, I emphasize the fact that when you see these children in the wintertime and they've had DPT vaccine, doesn't mean they don't have pertussis. They just tend to have a modified version of pertussis. So we have a bit of a dilemma. And as I've often thought, one of the reasons I love homeopathy, why I find it so interesting, is I often say, I'm looking to find my Dr. Moriarty. I hear Sherlock, and he's looking for clues. And that's what we're doing. We're looking for clues. Sometimes those clues are presented clinically in the case taking, with the phraseology, with the words, with our objective findings, with our otoscopes and our stethoscopes, through our palpation and our auscultation. Sometimes the clues come from our laboratory work, particularly in more severe pathological cases, where that lab work is often intriguing and interesting. I just, as a side note, I remember my first case of polycystic ovary disease in a young woman who ended up responding very well to cyclamen, as it were. And the lesson that was taught to me in this case was she was diagnosed with polycystic ovary syndrome, but she didn't have cystic ovaries. She had all the other symptoms. Anyway, so here we have no real clear diagnosis, not whooping cough. He gets it every winter. It lasts until the spring. I think this was about the third winter in a row where this child had this condition. Again, why I'm mentioning this particular case was the fact that since this case, I've seen many more cases like this. I had one again this winter with a little guy. I think he was about 8 or 9, with a similar kind of story. And again, my question was, well, what happened at this time of year? It wasn't a condition going around. He hadn't got wet. He hadn't got cold. He didn't have a coryza. He didn't have a propensity to bronchial problems. He had no particular bad reactions to any of his vaccines. There was no tubercular underlay in the miasmatic indicators. There was no, TB in the family. Often I'll see this. It's one of the miasms that I'm able to trace down fairly quickly. But I still didn't know what was going on and what the heck were these little white skeletons. This really bothered me. And again, I knew that when I got to that problem, I'd have a solution. Again, another little slide in, especially the younger students who are just getting into practice, just a little chart to differentiate between stridor, which we talked about with the croup, and again up in this area, up in the top. And while his hand would go there, when you put the stethoscope there was nothing to hear. There were rhonchi, and the rhonchi were at about the level in the bronchi, about where the bifurcation takes place. So clearly we had some rhonchi. It made me wonder again about antimony, but it wasn't out into the lungs. There weren't rales. They weren't down in the lower lungs. There weren't crackles. There wasn't anything in the back. There wasn't some of the other typical sounds that we can pick up through using our stethoscope and just having a listen. As a clinical diagnostician, when I first started, of course, as a naturopath, we didn't really have access to a lot of laboratory diagnosis at the time. Now we do, and that's made life a little bit easier. But I'd had to learn to become a clinical diagnostician using my eyes, using my ears. I didn't taste a lot of urine to check for to check for diabetes, but those options were always open to us. So again, we have rhonchi, and again, if we look at our objective for rhonchi or rales in the bronchi, again we pick up our remedy antimonium. Here's an allium group. Here's ipecac. Ipecac was one of the remedies I considered because of the vomiting and the vomiting of the mucus, but there was no nausea. There was no upset tummy. He wasn't off his feet at all. He didn't feel sickly in that sense. Again, we might think about phosphorus, but again, no bleeding, no hemoptysis, no coughing up that would make me think to remedies like that. And again, so I'm at a point that I've clearly got some kind of a bronchitis in front of me with this little guy. But again, why? What happened? And again, that's always the dilemma for me. What I'm trying to figure out is what happened? How did he get this? How did he get sick? Here's a sort of an abbreviated list of some of the remedies he's had. Sambucus nigra, Sanguinaria canadensis. Drosera, of course, was one of the first remedies he was prescribed by a colleague. Again, most of these remedies, if you look at it, you'll see that he has some of the symptoms of all of these remedies. But when you put all the pieces together to get the sort of totality of characteristic symptoms, there are pieces missing in each one of them. Sambucus, Sanguinaria, Drosera. Cuprum, of course, was prescribed because of the cyanotic aspect. Drosera was prescribed because it was called 100-day cough. Coccus cacti, coral rubrum. Again, with Coccus cacti, there's usually some irritation in the upper bronchial and tracheal area to cause the cough. But what were these little white skeletons? That bothered me. Squila, or sometimes called Squila, SC, or sometimes spelled SQ, Squila pulmonare. He's had many of the polys, silica, phos, natrimur, sepia, pulsatilla, nux vomica, all of which really had no long-term benefit. Some of these remedies would help a little bit, sort of for the short term, maybe a day or two, but then nothing to follow. And again, of course, he had the classic trilogy for croup of aconite, hepar, and sepia. Excuse me, aconite, hepar, and spongia. So what I did at this point then is simply went back and took a look at some of what I figured were the symptoms that we couldn't argue about. He had cough to choking, no doubt about it. His eyes lacrimated when he coughed. He had retching and gagging from coughing. He had his breathing would be affected. This was to try to get at the idea that there were times where he was cyanotic and times where that he was not cyanotic, but he definitely had problems with his breathing. And again, a nice physical characteristic, cough, holds hands with both chests while coughing. Now, he didn't actually hold both hands. Sometimes he had one, sometimes he had this. But I noted that, and again, the cyanosis, I noted that the remedy that showed up was Sina, the pinworm remedy. Here's Ipecac, here's Drosera, here's Cuprum, Nux vomica, opium. Kali carbonicum was one of the remedies I was very much considering, because I thought, well, Sina's a remedy for pinworm, for Pete's sake. He didn't have itchy nose. He wasn't boring his face in the pillow. He didn't sleep with his bum in the air. He didn't have his fingers up his butt scratching. None of those symptoms that I had learned initially as symptoms of Sina, he had none of them. So, but I knew that pinworm could be a problem, and often when I have pinworm or parasitic infections in children like this, I know that some of those parasites can be carried by the household pets. Often with pinworm, in the old wives' tales, the pinworm was carried by cats. You know, the cats defecated in the sandbox, and then the children played in the sandbox, and that's how they picked up the pinworm, and then they gave it to their friends, and so on and so forth. So I asked, well, do you have a cat? Yes, they do. Oh, really? And where's the cat's litter box? Of course, here in Canada, for most cats are indoor cats. They're not out roaming around, especially in the winter. And it turns out that the cat's litter box was in the furnace room. So then the question was, well, wait a minute. Well, the cat's litter box is in the furnace room, and the cough starts in the fall. Does the cough start maybe when the furnace gets turned on? That the pinworm spore is actually being blown around the house through the central heating system? Does the problem start each winter when the furnace comes on? That's the sort of rhetorical question in my mind that maybe answers the question here. Did the cat's pinworm spores end up being blown around? And so I thought, well, maybe Sina is the remedy. Let's take a look at some of the other. Let's take a look of what the literature tells us about Sina. So here's a few quotes. Here's one from Lilienthal. I like Lilienthal as a therapeutic text. It's an older text, but it's very well written, and it's very simple to read. It's not high tech. It's very low tech medicine. He says, great bronchial irritation in children, cough nearly constant, short, dry, spasmodic, with a feeling of something would rise up in the throat. Oh, could this be the little white skeletons that he was talking about? On which he tries to swallow, short, hacking, dry cough, mucus rails in the bronchi. Now, I wouldn't call them rails. Technically, in our literature, in our repertories, rails and bronchi are often used interchangeably. It's part of our problem in homeopathy that the terminology is not very well standardized. And some author would call it a rail, and the other person would call it a bronchi. For me, a rail's at the bottom of the lungs, and a bronchi is in the bronchi. It's an easy way to remember it. But here, Lilienthal has said rails in the bronchi. Okay. Moaning at night, well, yeah, I guess moaning, complaining, crying, upset, with restlessness, cries, bronchial catarrhs from the slightest exposure to cold and damp. Now, he does have bronchial catarrh, there's no question. I don't really know in this particular case that it has been triggered by cold and damp, although, of course, the season suggests that might be problematic. But I'm much more suspicious that, in fact, he's breathed in pinworm spores. Vandenberg says a dry cough, tickling low down in the bronchi, okay, good, I'm happy. The bronchial cough, mucus rails, tickling in the bronchi, rattling cough, rousing from sleep, which this definitely does for this child, very cross and often. Uh, I've noticed over the years is a remedy on the mental level that you can easily confuse with chamomilla. They have that same kind of capriciousness, irritability, but instead of within chamomilla, you see this irritability and upset is caused typically in children by pain of some sort. Often we think about dentition, for example, where in Sina it's from an irritation or an itch, a characteristic Sina itch. Herring goes on to say a little bit more. He says, on attempting to cough, it causes a peculiar hoarseness, soundless cough, pain in the larynx, aphonia, paralysis of the vocal cords. Now, in this particular case, the child has expressed to me during the interview that he doesn't like to talk too much with this problem because it makes him cough. So there clearly is some irritation in the larynx and in the vocal cords. Great bronchial irritation, mucus rails and the bronchi, again, we've got it. Frequent rubbing of the nose. Now, he doesn't do this one, right? This is a really good symptom for kids where the irritation is in the mucous membranes in the nasal ali. The bronchi is short, rapid respiration, rattling, coughing, very cross, irritable. He's not particularly cross and irritable. He's a little tired. He's a little exhausted. He's a little worn out. He's a 5-year-old kid with a nasty cough and he's not getting good sleep. So of course he's a little he's not dancing in the office having a good time. His pulse was not particularly elevated. I think he had a pulse of about 85, slightly higher, but in a child, I'm not particularly interested. Bronchial catarrh, diarrhea, no, and helminthiasis. Now, again, I believe my working diagnosis in this case is a bronchitis due to parasite. Now, when I went searching in the literature, I did find some references in cattle to bronchitis with parasitic infection, and I did find some literature that suggested that pinworm had been found in the bronchi and had been found in the biliary tract in the liver. So it wasn't simply an intestinal parasite. It did show up in other areas. What I did find in NERS repertory, which, as you know, is a repertory on Herring's guiding symptoms, a repertory that I very much like because of the characteristic symptoms that it tends to present. You'll see that there are typically, there's no remedy of a higher grade. There's one remedy, and there's one remedy, and the one remedy is Sina, and the rubric is bronchi, mucus, rails, the exact objective finding that we had in this particular case. So now I'm feeling much, much happier about prescribing Sina for this child. I go a step further to look at some of the other repertory indications, and I see cough from choking, cough in the morning after rising, cough from choking in the morning after rising. And then I found this little rubric, mind fear of talking to avoid coughing. Now, I wouldn't have thought that this child was afraid of talking. I wouldn't have called it a fear based on how he expressed it. But again, our repertories, we have to use them in two different ways. One in a very literal expression where we take the exact word, and in the other way in a more figurative expression where we can expand its usage a little bit. I learned this trick years ago with chamomile again, where we talk about desires to be carried. Well, that literally means physically desires to be carried, particularly in children, but also I've seen chamomile in adults where they have a desire to be carried, but not literally, figuratively. They need to be helped out by someone else. Someone else needs to carry the burden, not them physically, but to carry them, to help them out, to do what they need to do. And so that figurative use of the repertory has expanded my use and understanding of various rubrics in the repertory, particularly in chronic cases. Startles from sleep, whimpering after coughing, weepy, tearful in coughing. Then this one, eyes, lacrimation during cough. Again, one of the symptoms that I noted earlier that shows up for this child. Face, bluish on cough, stomach retching and gagging from cough, larynx and pain during cough, respiration arrested, which we took in that original workup, holding the hands with coughing, rawness in the sternum. So in this area, again, as I mentioned, he'd put his hands here or he'd put his hands here over the sternum. Rawness in the sternum during cough. Nice little rubric, and only Sina there. I often pay particular attention to these very small little rubrics, particularly, excuse me, particularly when there are 3 or 4 of them showing up in the in the repertorization. The odds of finding, for example, here's 1 here, here's a 1 here, here's a 2 here, here's a 5 here, here's another single. There's 1, 2, 3. There's 5 single rubrics with only 1, 2, or 3 rubrics in them. Excuse me, remedies in them, and the probability of that happening is astronomical. I'll often prescribe on 3 rubrics with 1 or 2 remedies in each rubric, and if the 3 rubrics all contain the same remedy, I'm pretty convinced I've got the right remedy. So now I'm feeling very happy. I give the child a Sina. We give him Sina 30, and he does quite well. If we take a look, just to sort of emphasize some of the other aspects here, again, these are some other singular rubrics for Sina. Again, we're only Sina. Eyes are affected before the cough. Rawness in the sternum, again, where he places his hands. The gurgling noise extending downward after coughing. Unconsciousness, it's not a factor in this particular case, but they can become so hypoxic that they pass out. So it doesn't necessarily have to be whooping cough, all right? And again, I've noticed, as I said earlier, every winter I see this now. Once I saw this particular case that had, I don't know, I think in total maybe 10 or 12 different remedies until we finally settled on Sina. This comes up again and again. It's not whooping cough. It's not croup. It's a parasitic infection, and it's a parasitic bronchitis, which you don't see much in the literature on, but it is there. Vertigo from coughing, sickly looking from coughing, pale complexion, head pain so head pain drawing in the temples. I find with kids, they don't do this one, they do this one. They don't go particularly to the temple, like we talk about with nux vomica, having a frontal headache in the forehead with a block going from temple to temple. Adults might tell you this, but kids won't. Kids will just put their hands there. Swallowing disposition, again, throat swallow disposition after coughing. He's, again, trying to push those little white skeletons back down. A few others, and you can have a look through these. I won't waste your time reading all of these, but it's one of the ways I study materia medica is to do an extraction through the repertory and look at only this particular small rubrics for which only this remedy is there, and based on that collection of rubrics, we'll build a picture of symptomology of this remedy and this remedy only. The old way we looked at remedies and we do differential. If you look at the old IFH case, materia medica study, back in the late 1800s, it typically started with sulfur, and then you did lycopodium, then you compare sulfur and lycopodium, and then you did calc, and sulfur and lichen calc. And that's great when you only had 100 remedies. Well, as you know, we have well over 7,000 different remedies in our materia medica now. You can't do that. We don't have time for that. Time, as has been mentioned, is a critical factor here, and so the computer versions of the repertory allow us to study our materia medica. It's almost as good as studying the provings. Sometimes there's a problem in that rubrics don't get translated properly from the provings into the repertory. I've seen this a number of times where I've ended up prescribing a remedy based on the proving and look for that same remedy in the repertory, and it's not even there. It's in the proving, but it's not in the repertory. It didn't get translated properly. And there's a few other: angry from coughing, paroxysmal from few coughs, teeth grinding. Again, another good symptom A good clinical indication when you see teeth grinding, that may be an indication that the child has pinworm. There are other remedies, but then you can go and pursue some of the other clinical symptoms that are typical of a child with pinworm. If we take all of those rubrics and graph them, we get a chart that gives us an idea of some of the other remedies that compete with SINA. And you see, of course, you see Drosera there. Probably I think this child saw a couple of other practitioners, and Drosera got prescribed a couple of 3 times, and no real surprise, right? It's 100-day cough. It's a cough that goes from the late winter into the early spring, but it doesn't cure the case. Here's cuprum down here, so the cyanosis. Here's bryonia, but although it has this dry cough, bryonia has other characteristic symptoms that you wouldn't think about. Chlorines here, belladonna here, but again, no high fever, no injected eyes, no tonsillitis, nothing else that would indicate an indication to go ahead and look at excuse me, belladonna. Again, just I'll leave this for you. I won't spend a lot of time. We've almost come to the 10-minute 2 mark, and I want to let people get back on track and don't want to cut your lunch short. This is a little extraction from Vermeulen's Prisma. Vermeulen's texts I find are very, very useful. Vermeulen and his wife Linda I met some years ago at a Sankaran conference, a lovely woman, very, very intelligent. Anything that these folks write, you can depend upon, solid material. But he mentions, the reason I put this in is because he mentions this compound called centonin. So, and I wanted to mention this because we have a remedy called centoninum, which is a remedy made from the alkaloid from SINA, from the pinworm, the actual active chemical principle. Just like we have strychnine taken from Nux vomica, which makes looks like Nux vomica on steroids, cranked up Nux vomica. Santoninum is a remedy to consider when you've given a SINA case, typical pinworm case, and particularly if it's been suppressed. Often you'll find these kids have been put on antiparasitics, and of course it goes away for a little bit, but it tends to come back, and sometimes you'll need to come in with santoninum. And at last, a little picture just to show you what it looks like. And the last slide, which says, SINA has cured this case and many others like it. It's become, as I said, every winter I see this remedy show up. It's become a very good friend. I think about remedies as friends. And then I remember years ago when I was studying with Vasily, Vasily's very much emphasized how important it was to call the remedies by their full name. When you first meet the remedy, you show respect and you give it its full name. It wasn't Pulse, it was Pulsatia. And then once you got to know it, and it got to know you, it would show up in your office and let you know it was there, you could call it Pulse, but not in the beginning. So full names were important. Become a very good friend. And again, the clue in this case, the answer to what happened is when the furnace came on. So if you're living in a country in the winter where you have central air and central heating, and the furnace clicks on, and that sort of corresponds to the problems, because the pinworm spore, just as I mentioned, another little case, excuse me, another little case, same kind of story. But when I asked about cats, they had no cats. And it perplexed me for a little bit until we talked a little bit more, and we realized they'd only been in the house a couple of years, and the previous owners had cats, and they hadn't had the ducts cleaned out. So there was still pinworm in the ductwork. And when the furnace came on, of course, the pinworm spores developed out. That takes me to time. I thank you very much for your attention, and maybe we could field a couple of questions if there are any. Otherwise, we can go and have some lunch and have something to eat. I hear silence.
Thank you, John. So any question?
I just have one. Does that mean that the child actually had pinworms?
So the question is, does it mean that the child actually had pinworms?
It's a good question. And in this particular case, I believe so. But there's two kind of ways of looking at this case. One is that he actually had pinworm, or he had a symptomology as if he had pinworm. And as if is homeopathy. As if would be more of a chronic case. So if he'd actually breathed in pinworm spore, and I believe this child did, he had all the symptoms, all the factors were present to suggest that he did have pinworm. And in the cases I've seen, for example, the one this winter that I just saw, a couple of months back now, the cat slept in the kid's bed. So that again, there was the exposure. So yes, he could have pinworm, or it could be just as if he had pinworm.
Thank you, John. Another question? Yes?
Did they have to get rid of their cat?
Does it mean they have to get rid of their cats?
That's not for me to decide. Yes, what I do have them do is, yeah, put the litter box someplace where it's not going to. Where in this particular case, the litter box was in the furnace room. Not a very good place for the litter box. Is there a good place for the litter box? Maybe not. Maybe the laundry room would be a better spot. But yeah, little things. It's like telling somebody you have a case, a tubercular case, and they have cat allergy or animal dander allergy. Do you get rid of the cat? Well, the allergist would say, yeah, get rid of the cat, get rid of the dog, get rid of the hamster, get rid of the guinea pig, whatever the case may be. I think hygienically we can probably address this a little better. Maybe, as is often the case when you have external triggering factors, to simply get rid of the factor in the short term until the homeopathic remedy has done its job and the vitality has increased and their susceptibility has decreased. Then they can be exposure to those triggering factors, and they're no longer triggering factors.
Question here, and then
In this particular case, what potency and dosage was used?
what were the potencies and doses?
This particular case was a 3-day dry dose of a 30.
Thank you. Heather?
Two questions, well, a two-part question. One, would that have indicated like some kind of tuberculinum miasm? And then we did his parents have anything if it was being circulated in the house? Like,
could you just say that again? I sort of started thinking when you were asking the question, and I had
so I wondered two parts. One, did anything affect the parents because the spores were being circulated in the house?
No.
And two, would it have shown a tuberculinum taint for the child, some kind of weakness there?
I don't think so. I think, it's like we have a lot of conditions that our susceptibility has to do with age. We have, measles is chickenpox. Adults don't get chickenpox. Adults get shingles, but they don't get chickenpox even if they're exposed to chickenpox. So there is definitely a susceptibility of being a child, just like there's a susceptibility of being an adult. An older adult, an older adult gets pneumonia. This is not good news. They're more susceptible. They're more easily damaged by it. A 20-year-old guy gets cold and falls through the ice and ends up getting a case of pneumonia. He may do very well, but if it's his 87-year-old grandpa, it may kill him.
Yeah.
So I think the susceptibility has something to do with the age.
I can share that from a couple of my own cases with SINA. When you think of the idea of the parasite, it's a symbiotic relationship, but it's also something that you want to get rid of. One thing that is quite well known, as John mentioned, is SINA children can be very irritable. They can be a handful. If a person has a feeling that I am a pest, or they treat me as if I'm a pest and they want to shut me down, or it can create the same pathology as if they have a parasite because they perceive themselves as if they're being treated like that.
Yeah, you're bringing out a dynamic that goes beyond what I wanted to get into, but there's a lot of truth in what you say, Sharon.
Thank you. Anybody else? Any other questions? Oh, very good. Thank you so much, John. That was a wonderful presentation.
Good afternoon. I believe you had a good lunch.
Yes.
And Dr. Sharam, my brother, I will call him brother, is a really, really good host, and I'm very pleased amongst you here. And I hope you will enjoy the second session. In the first session, I really enjoyed your lecture, Dr. Sharam, and our dear dynamic Dr. Nanda Kumarji, always great, and John Miller. So this session is the second session, and I think we believe 5 o'clock it will be over, and you will keep the memory of the day for a long time. You will learn something special today, and you will be in our thoughts, and we will keep you in thoughts. So I am introducing one of the dynamic speaker, like our Dr. Nanda Kumar is very popular. This gentleman is very popular in India, and he is a member of scientific committee of the Central Council of Research in Homeopathy. And actually, I asked him to send a brief CV, but his brief CV is 7 pages. Half the time of the lecture will be gone. So I am telling you something which is really related to him. He is a very, very dynamic homeopathic doctor in Indore, India, and he is organizing a lot of events. And he is editor of one book. Is Hindi is called Sehat and Surat, health, face and face visibility. So it is very different. I can't exactly tell about this. And I hope he will present this session. And his lecture is on the Aplastic Anemia. And I give him the way better. Otherwise, 7 pages will take half the lecture. Thank you very much. If there is anything, I come back to you. Thank you.
Thank you, Dr. Sharma and the Canadian College of Homeopathic Medicine, Toronto, Canada, for giving me an opportunity to talk on homeopathy for aplastic anemia. Myself, Dr. AK Dwivedi, member, Scientific Advisory Board, CCRS, Ministry of Ayush, Government of India, Professor and Head of Department, Physiology, SKRP, Gujarati Homeopathic Medical College, Indore, as introduced by Dr. Shashi Mohan Sharma, editor of Sehat Yom Surat, Hindi monthly medical magazine. I am working for aplastic anemia since last 25 years, and President of India, Srimati Draupadi Murmuji, appreciated my work on aplastic anemia, sickle cell anemia, and thalassemia, as well as the Finance Minister of India, Srimati Nirmala Sitharaman, has also appreciated the work and mentioned in the budget of 2023 and 2024, which is published by Government of India on 1st February 2013, that the country will make anemia free by 2047. We are continuously trying for the awareness of anemia throughout the city of Indore. We are running a anemia awareness run every year from the last Sunday of the February month till 4th March of every month, every year. 4th March is the Aplastic Anemia Awareness Day. We are organizing every year a seminar for the awareness of the International Day of the Aplastic Anemia Awareness. The lecture is by the eminent speaker. They all talk on the anemia, causes of anemia, and bleeding disorders by this aplastic anemia. Then what is the aplastic anemia? Aplastic anemia develops when damage occurs to your bone marrow, slowing down production of new blood cells. Aplasty means there is no formation. So aplastic anemia develops when damage occurs to our bone marrow, slowing down production of the new blood cells. What are the factors responsible for this? First of all, the aplasty may be temporarily or permanently. That is due to the injury of the bone marrow and the affected blood cell productions. The causes are radiation and chemotherapy treatments, exposure to the toxic chemicals, use of certain drugs, autoimmune disorders, viral infections, and there are several unknown factors. If I will talk about the unknown factors, which I found during my practice time, I found that drinking of too much of alcohol may cause bone marrow disorders. Taking of so many antipyretic drugs may cause bone marrow disorders and may cause aplastic anemia. Then taking of some steroidal drugs or some sexual arousal drugs that may also cause aplastic anemia. Then what are the symptoms of aplastic anemia? Symptoms are fatigue. Patients gets fatigue, then fever, continuous fever. Either it may be a rise of temperature, that is the hyperpyrexia or pyrexia. Then shortness of breath with exertion. Shortness of breath while climbing stairs or while exertion. Then rapid or irregular heartbeat. Then pale skin, frequent or prolonged infection, unexplained or easy bruising, nose bleeding, and bleeding gums. Then profuse menstrual bleeding is also the prominent symptoms of the aplastic anemia. Many patients come to me, those complaints that their bleeding is continuous since last 3 months, 4 months, up to 6 months. Then prolonged bleeding from the cuts, bleeding never stops by any medicines. Then skin rashes, dizziness, and headaches. Another type is paroxysmal nocturnal hemoglobinuria. This disorder causes red blood cells to break down too soon. Paroxysmal nocturnal hemoglobinuria can lead to aplastic anemia, or aplastic anemia can evolve into paroxysmal nocturnal hemoglobinuria. Another type is Fanconi's anemia. Is a rare inherited disease that leads to aplastic anemia. Children born with it tend to be smaller than average and have birth defects such as undeveloped limb. Risk factor: the use of some drugs such as chloramphenicol, which is used to treat bacterial infection, and gold compounds used to treat rheumatic arthritis. Certain blood diseases that may be autoimmune disorders and serious infections, dengue, and kind of skin treatment, painkillers, antipyretics. Many patients are coming from all over the India as well as many parts of the world that they are having low platelet counts and low hemoglobin, along with shortness of breath, weakness, body pain, and bleeding. Aplastic anemia can progress slowly over weeks or months, or it may come on suddenly. Sometimes it can be seen accidentally while patients come to the doctors and doctors advise them CBC, complete blood counts, and found that the platelet count is very low. Sometimes it may be 2,000, 10,000, while normal range of the platelet is 1.5 lakhs to 4 lakhs in normal, healthy human being. The illness may be brief or it may become chronic. Aplastic anemia can be very severe and even fatal. Aplastic anemia is a serious disorder. Many patients goes for the blood transfusion. Some patients, they told me that they are going blood transfusion for every 3rd day, yeah, every week. Some may complain that they are going for blood transfusion in every 10 to 15 days, while the platelet transfusion may be more frequent. It may be twice a week or every 3rd day or every 2nd day, sometimes 3 to 4 platelet transfusions, that is PRP or SDP, may transfuse in the same day. Then what is the role of homeopathy in aplastic anemia? Homeopathy medicines attempt to stimulate the healthy portion of the bone marrow to improve cell production. This may help to reduce the number of cell transfusion. The major problem of these patients is the blood transfusion. They need very frequent blood transfusions. So if we will prescribe them homeopathic medicines, what the homeopathic medicines will do, that will stimulate the healthy portion of the bone marrow to improve the cell production. Bone marrow, while diseased, does 2 things. It will stop the production of new cells, as well as it will destroy the cells after the transfusion. So homeopathy medicines may help to improve the cell productions, improve general vitality, as well as well-being of the patients to help him fight against infection. If hemoglobin lower downs and platelets lower down, the patients get very frequent infections and their immunity is very lower. So patients are always suffering. They may get very high fever, sore throat, bluish spot over the skin, sometimes breathlessness. Homeopathy is beneficial in countering side effects associated with the conventional therapy, control bleeding disorders associated with the aplastic anemia, balance disturbed immunity. Patients feel very lack of immunity. The homeopathic medicines will help to make them better and improve their immunity to fight against any kind of infections. What are the homeopathic medicines? Homeopathic medicines are very effective. Choice of medicine. First medicine is metallicum. Weak and paleness and have frequent false flushing, appearing at the slightest excitement. Then vertigo, pulsating headache and ringing in the ears, difficulty in breathing and palpitation of the heart, coldness of the body, anemia due to excessive bleeding during the menstrual period, when period lasts longer than the normal. As I earlier talked, that many patients complain that their menstrual period is lasting for 2 to 3 months. Few complaints that bleeding continues from 3 to 6 months. Next medicine is Cinchona officinalis. Very good medicine of anemia. Best remedy for anemia following excessive bleeding. Anemia due to loss of the vital fluid, that is blood. Bleeding can be a result of a traumatic injury, excessive bleeding in periods, or bleeding from any part of the body like throat, bowel, nose, etc. Patient is exhausted and even fainting spells. China acts as both as hemorrhage controller as well as and enhances the amount of blood after the bleeding episode. Two things is more common in these patients. One is continuous bleeding. So Syncona will help to stop the bleeding as well as enhances the amount of blood after the bleeding episodes. Another medicine is natriureticum, best medicine for anemia with weight loss. While there is loss of hemoglobin, the patients having complaints of weight loss. Another symptom is headache. So natriureticum is the good medicine for headache also. Many patients come to me that and narrating that they are taking painkillers for their headaches or migraine. Due to that, their bone marrow stop produces the new blood cells, and while going investigation, they found that their hemoglobin and platelets are reduces. Patient is lean and emaciated with the loss of flesh. Nausea and vomiting may accompany the pain in head. Another symptom is palpitation, craving for salt, effective for anemia following malaria. In bad effect of malaria, the medicine is natriureticum, known to cut bad effects of taking excessive quinine used as an anti-malarial drugs. Next homeopathic medicine is phosphorus, very effective for pernicious anemia, numbness of hand and arms, long lasting of diarrhea with weakness, desire for ice cream and cold drinks, anemia due to kidney diseases. Nowadays, CKD, chronic kidney disease, is most common, and while creatinine increases in the body, hemoglobin gets down. Day before study, I see a patient having creatinine 8.5 while hemoglobin is 8 gram per cent. So medicine is phosphorus. Next medicine is alumina. Alumina due to nutritional disturbances, sluggishness of the gastric system, and the person remains very constipated. Stool is retained for many days together. Urge to pass stool is absent. Pica is dominant, and there is a desire for chalk, coffee, grounds, and other indigestible things. Sensitivity for cold air. Arsenic album for anemia following with malaria. Marked weakness that gets worse at night. Person seems exhausted with much weakness, anxiety, and restlessness. Next medicine is calcarea phos. Calcarea phos is also a very good remedy, best remedy for children with anemia and weak digestive power. Abdomen is full of gas. Desire for salt or meat, especially smoked meat, is often noted. Child is usually irritable and also has weak bones. Next medicine is calcarea carb, is suited to fatty, flabby persons who have a desire for line, chalk, and pencils. Copious sweats on head is a guiding symptoms of calcarea carb. Patients have craving for boiled. Next medicine is nitric acid. Anemia with craving for chalk, pepper, earth, or any such indigestible things, often cuts off corners of mouth, apathy or ulcer in mouth, as well as I am prescribing nitric acid in the bleeding piles cases, and in aplastic anemia patients, bleeding pile is most commonest. The medicine is nitric acid. Next medicine is pulsatilla. Excellent remedy for anemia of those patients who were heavily and irregularly drugged by medications and tonic or due to the accidental stoppage of menses, weeping disposition, and cries at the drop of a hat, Patients feels better in open air and worse in heat. Thirstlessness is another guiding symptoms of this remedy. Next remedy is calcarea carb. Blood lacks red blood cells. The skin is milky white or watery with great debility. Young ladies with the time of puberty have a menstrual trouble on account of the weakness, blotting of face, eyelids, and backache in the lower back. This condition occurring during menopause, especially blotting, this remedy is indicated. Complication. There are several complications of the aplastic anemia. Severe infections or bleeding, complications of bone marrow transplant, reactions to the medicines, bleeding per rectum, and bleeding PV, that is per vagina. I have seen so many cases where after bone marrow transplant, they consulted me, and when there is a bone marrow failure, so there will be no life. Conclusion, homeopathy can cure aplastic anemia if the doses of the properly and prescribed homeopathy medicines are taken on the basis of investigation reports. I am sharing my research paper, Aplastic Anemia, where I have summarized. There are the age group, distribution of different age group patients as under 03 to 15 years, 25 to 32% of the patients I have seen, and 16 to 45 years, 33 to 45%, 46 to 65 years, 20 to 30%, and 66 years to 85 years, the percentage of the patient is 10 to 15%. And found the result of what medicine I talked earlier. The Eupatorium perforatum gives its better results by 70%. Eupatorium perforatum is a very good medicine to increase the platelet count in the body. Eupatorium perforatum is used in dengue fever. Very commonly known medicine of homeopathy is Eupatorium perforatum. I am using this medicine in aplastic anemia also. Eupatorium perforatum increases the platelets very quickly. Another medicine is carbobase. Carbobase gives the strength to the patients, as well as while the patient is having palpitation, carbobase relieves them. Arsenic album. When the patient loses the hope of life, arsenic album will help. So the Eupatorium perforatum gives 70% result, carbobase 30%, and arsenic album 24%. So platelets increases by this medicine. Pancytopenia and hematuria. Medicine is hemamylase. Hemamylase gives best result in hematuria. The most commonest problem of the aplastic anemia is hematuria and bleeding from the vagina or bleeding in the stool. Medicine is hemamylase. Then another medicine is phosphorus, ferrum phos, and then bleeding from any means, any orifices of the body, the medicine is hemamylase. I have also summarized like this: when RBC decreases, platelet decreases, WBC decreases, overall all blood cell decreases. When the RBC, WBC, and platelets decrease, the condition is known as pancytopenia. This is one of my patients, Miss Sikha Garg, age 22 years. She consulted me first on 6/10/2009 with the diagnosis of PNH positive. Her hemoglobin was 3.5 gram% and platelet is 10,000. Complaints of profuse menstrual bleeding, black spot on the body, history of chikungunya in 2016, and dry cough. Dry cough is another very important symptoms of the aplastic anemia. Sometimes patients complain that their coughing is continuous while sleeping. I have given her medicine for 2 years, continuous for 2 years, homeopathic medicines. Firstly, I stopped her blood transfusion, then gradually her hemoglobin increases as well as platelet increases, and at present her hemoglobin is more than 10 grams and platelet is more than 1.5 lakhs, and she is living totally normally. Many such patients are cured by homeopathic treatment who have having no further complaints. Mr. Masi Ujama is 57 years. You can see the age difference. The Sikha Garg was 22 years female, while the Masiha Azam is 57 years male from Bihar state of India. Date of first consultation is 17th January 2019. His symptoms is breathlessness, bleeding during angiography, increased level of the uric acid, eczema, itching in lower limb, hepatomegaly. At present, completely cured and having no further complaints. Their testimonials, their video is uploaded my YouTube channels. You can go through on YouTube and write Dr. AK Dwivedi Aplastic Anemia, or you can write Aplastic Anemia homeopathic treatment Dr. AK Dwivedi. You will find their testimonials, Sikha Garg and Masiha Azam, as well as many patients who has cured by the homeopathic medicines. I am presenting three kinds of cured cases. First is female, that is the Sikha Garg. Second is male, that is the Masiha Azam, who is from Bihar, Champaran, and another who is Sivan Singh of just 20 months, 1.5 years. He is also from the state of Bihar, that is Ara district. Date of first consultation was 3/5/2021. You can see the duration of 2020, that is 2020, and 2021, that is 2021, is the duration of COVID. So his first consultation was online. He consulted me in the May of 2021 on video calling. His father shown me this child and narrate me all the symptoms and share me all the investigation report. He told me that they have taken lots of the treatment in the AIMS, New Delhi, and doctor suggested that there is no conservative treatment, go for the bone marrow transplant. But unfortunately, the bone marrow matching not done by the siblings. So they contacted me. The complaints is bleeding spot on the body, fever, bleeding spots, nosebleed, and history of transfusions multiple times. Completely cured, no further complaints, not any medication. Another case of females is Iram Se, who is from Mumbai, Maharashtra, India. Iram Se is the lady who is having aplastic anemia, as well as some doctors suggested that she is having bone marrow failure as well as blood cancer, and she is not going to survive more than 2 to 6 months. This is the condition of her in 2017. She consulted me first time on 17/12/2007 with the symptoms of bleeding gums, general weakness, bulky ovaries. Her CA test is 125, and the platelet was 5,000 only, and hemoglobin was 5 gram%. She has taken homeopathic medicines for 2 years, and at present she is completely cured, no further complications, no medication, neither homeopathic nor allopathic. Another patient is Samina Ahmed, age is 26 years. She consulted from Delhi. First consultation was on 21/12/2017. History of recurrent UTI, could not sit and stand for a long time, systolic murmur, chickenpox, PNH positive, anemia since 2011. She was diagnosed in 2011 and consulted me on 2017. After 6 years, she has taken medicines, homeopathic medicines from me for 3 years, and she is completely cured in 2020 before Corona. At present, she is completely cured, no further complications, not on any medication. Several press coverage on anemia and aplastic anemia. You can see here. Another type is idiopathic thrombocytopenic purpura, that is the ITP, that is immune thrombocytopenic purpura, also known as idiopathic thrombocytopenic purpura, is a type of thrombocytopenic purpura defined as an isolated low platelet count with a normal bone marrow in the absence of other cause of low platelet. Previously, I was talking about the aplastic anemia, where bone marrow is diseased or not working or aplastic, but in ITP, bone marrow is normal while the platelet count is lower. It causes characteristics of red or purple bruise-like rashes and an increased tendency to bleed. Symptoms: easy bruising, extreme bleeding, bleeding from gums and nose, blood in urine and stool, usually having menstrual flow. Causes: caused by immune system mistakenly attacking and destroying the patients. A viral infection such as flu or mumps can affect the platelet count by triggering an immune system malfunctions. Increased breakdown of the platelet associated with the use of certain drugs. The choice of medicine in homeopathy is Epitorium perforatum, arsenic, and phosphoricum. Another condition is myelodysplastic syndrome, that is MDS, a group of disorders resulting from poorly formed or dysfunctional blood cells. This condition is rare, fewer than 10 lakhs cases per year in India. Often require lab testing or imaging. Treatment can help managing condition. Homeopathy may help. Symptoms: as the disease advances, it may lead to the following symptoms: constant fatigue, tiredness, shortness of breath during activation or exercising, pallor, unusual paleness resulting from anemia, easy bruising or bleeding, patchy, a pinpoint size red spot beneath the skin, frequent infections. Causes: myelodysplastic syndrome results from the changes in the bone marrow that leads to the production of the defective and immune blood cells. Also, due to the aging and after the cancer treatments such as chemotherapy, radiotherapy, exposure to the chemicals such as tobacco, smoke, pesticide, and benzene. Another condition is pancytopenia, a medical condition in which there is a reduction in the number of red cells, white cells, as well as platelets. If only 2 parameters from the complete blood count are low, the term pancytopenia can be used. And when all the 3 cells are lower, less than the normal, the condition is known as pancytopenia. What are the different foods which can help in the production of the red blood cells, or which can prevent the anemia? That are the roasted grams plus jaggery, warm milk with turmeric, almonds roasted, soybean roasted, spinach, papaya, dates, gram parched and ground with jaggery, frumentary plus jaggery plus milk, amla marmalade or amla candy, carrots, chiku, that is spondula, sugar beets, apple, pomegranates, raisins, kharak, crown, fish, and eggs. I have summarized many of the food materials which are easily available at our homes or in our kitchens that will help in the production of the new blood cells and prevent the anemia. With the proper medications, if you follow the proper diet, that will help to cut short the duration of the treatment. Those who are non-vegetarian, they can take fish or eggs. Those who are the non-vegetarian, they respond homeopathic medicines very well during the treatment of aplastic anemia, which I seen. You can see the patients which are treated, the most of them is from Muslim community who are taking non-veg. Samina Ahmad, Iram Sheikh, Masiha Ajam, three patients from Muslim community who are taking fish and non-vegetarian, so they respond homeopathic medicines very fast. So in this way, homeopathy will help to fight against aplastic anemia or any such kinds which will hamper the bone marrow. As per my research, you can use homeopathic medicines on the basis of not only the symptoms, but on the basis of the investigation reports. When there is the decrease of hemoglobin less than 5 gram%, I always suggest them for the blood transfusion along with the homeopathic medicines. When the platelet count is lower, less than 10,000, I always suggest them go for the platelet transfusion as well as go for the PRP or SDP transfusion. And many patients respond very well with the blood transfusion, with the platelet transfusion, and with the help of homeopathic medicine as well as the diet. This is all for the aplastic anemia. If anyone have any question, any query, I can answer them. Thank you, Dr. Sharma, and thank you, Toronto College of Homeopathy. Thank you to all for listening me. Namaskar. Hello, Dr. Sharma.
Yes, I'm coming.
Yes.
सो गए थे क्या? Are you
You
sleeping?
have another 10 minutes if you want. You can have another 10 minutes if you want any question answered.
Yeah, I can answer if anyone having any questions, any query, I can.
We won't pay you any
Okay.
fee today. Today is Sunday in Toronto.
Yeah, Sunday. Today is Sunday in India also, and it is
Oh,
Sunday 12
that's
past
okay.
10.
That's okay. Madam want to ask something. Yes.
Yes, my question was that for the aplastic anemia, he's told us all these remedies, the medicine that he uses. Is there any protocol with his the potencies he uses, or is different for different cases depending on the intensity?
Yeah,
Yeah. Go ahead, please. Tell me.
So
yeah, go.
maybe-
Very good question. Very good question. I will tell you about the potency. While the patients are having profuse bleeding, I always prefer to use a mother tincture of hemamylase. As I also explained in my lecture, hemamylase is the good medicine to stop the bleeding. So I always used to give them hemamylase in mother tincture form. And the calcarea fast, metamuraticum, and ferrum met as well as ferrum fast in the trituration form. That is the 2x, 3x, or 6x, whatever may be the available. So you can use calcarea fast, ferrum fast, and ferrum metallicum in the potency form of 3x, 2x, or 6x, and hemamylase in mother tincture form. And the other medicine what I am using is in the form of 50 millismol potency. I always used to give the patients 50 millismol potency, which is very user to dispense them. We use 50 millismol potency in distilled water. So the patients who are having the diabetes or high blood sugar, they can also use these medicines in distilled water, while other medicines in centesimal we have to use in globules, which is best used in the children's pediatricians, pediatric patients. I always prefer to give the globules, while the in diabetic cases, I always used to give in 50 millismol. So I always use decimal, centesimal, and 50 millismol medicines on the basis of the patients and their age, and on the basis of the blood sugar. And other medicines for bleeding, to stop the bleeding, I sometimes use lakhs, and sometimes I use phosphorus. It is in centesimal, either 30 or 200.
Lakhs is not in the repeated doses, one dose.
Yeah, lakhs is 30, one dose daily. Sometimes patients not respond to hemamylase, then I have to use either lakhs or phosphorus. And when these medicines also doesn't work, I always prefer to give them ipecacuanha, which will help me to stop the bleeding. When the platelet downs to less than 10,000, anytime bleeding may happen from any orifices of the body. Patient sometimes comes to me, the bleeding is coming from their ears, and sometimes having the bleeding in retina, eye bleeding. At that time, I used to give them arnica 1M.
Very good.
Retinal bleeding. I have seen very cases. Epistaxis is most common symptoms of the aplastic anemia. Many patients complain that they are having epistaxis and gum bleeding. We brushes our teeth daily and having a bleeding from the gums. So I give creosotum to stop the bleeding gums and phosphorus to stop the epistaxis.
Another remedy is carbovegetalis.
Carbovegetalis is I explained during my presentation.
Mhm.
Yeah.
Very good. Dr. Sharma want to say something.
There's a question about,
Yeah.
is it possible for one or the two of the patients that you have cured to show us?
Please come here, then he can listen better, please.
Yeah.
Yeah.
I think it would be nice if it is possible to show us a protocol for one of these patients that you have treated, or two. How do you start the treatment? How do you add remedies? How long do you stay with one remedy? How do you switch it to
Repetition of the dose.
the repeat?
Yeah.
Is there-
Very good question.
Yeah,
Very
he's
good
the dean
question.
of the Canadian College. He will ask better question than me.
Yeah. I am explaining you on the basis of their investigation report, my prescription based on the total pathological prescription. The patient is well diagnosed and having a file from the AIMS all over India, or PGI or CMC value Even sometimes patients are coming from the Nepal, Bangladesh, sometimes from Dubai, even from Canada and England also. So the patients is having diagnosis and having their investigation reports in which there is a platelet count, hemoglobin, WBC, RBC, even neutrophil and lymphocytes. So when the lymphocytes are raising, it means that they are developing MDS. So I always try to give them homeopathic medicines which stop the further raising of the lymphocytes. And first choice of medicine is to increase the hemoglobin. So the preference of the medicine is ferrum phos and ferrum metallicum. In the patients who are having the low hemoglobin, they are having low vitality, as well as they are having fever and body pain. So the medicine is ferrum metallicum. And for increasing their platelet counts, when they are having a very low platelets, I used to give them Eupatorium perforatum. And when they are having fever not responding to any antipyretic medicines, fever is lasting for 2 to 3 months in some patients, and they are hospitalized for 1.5 months. And after the hospitalization, after the treatment in hospital, their temperature don't gets down. So I always used to give medicine arsenic album and Cinchona bark, China officinalis, in the 200. Sometimes I used to give them medicines every 2 hourly. In case of bleeding, I always give them hemamilis every 2 hourly. And during fever, when the onset of temperature is very high, I always give to them medicine every 2 hourly. And when the fever settle down, patients having no temperature, then reduces the medicine. When the bleeding stop, I always use to reduce the medicine and their dosage. And when the hemoglobin increases and platelet increases and their blood transfusion stop, then I reduces the medicines. Gradually, the homeopathic medicines are reduces. Then when the platelets rises and hemoglobin raises over 10 gram%, I reduces the medicine, and still I advise the patient go for the investigation. Every 15 days, I have to observe their CBC report, their hemoglobin, RBC, WBC, neutrophil, lymphocytes, and platelet. On the basis of platelets and on the basis of hemoglobin, the medicines, repetition, and the tapering down of doses depends on.
Very good answer. We all love you. And I am sending you a lot of love from Canada. Everybody
Thank you.
Any
Thank
more
you.
question, please? And yes, doctor, what is your name? Dr. Bindia is asking a special question. Please come here.
Yeah.
Better, please. That will be better. He can listen and give the right. Your voice is going 7,000 miles away.
Okay.
Please.
So, sir, I have a question. If, for example, after a repertorization or, depending upon the case, if we have selected, for example, Natramur in a case, and there is a duration of action in repertory, if we see, so do we, and if we want to compensate platelets by giving eupatorium perf in between, do we hinder the course of action, or we should wait for the duration of action of medicine to get over?
No. We will not wait for the duration of the action of the medicine. We have to see the investigation report. This is not the functional medicine. This is not the functional disease. This is the totally pathological disease where the bone marrow is not functioning, their blood production is stopped, as well as the bone marrow is destroying the cells. So we have to see the investigation reports. The condition of the...
So the thing is, we should be giving eupatorium perf can be given with some other medication which is already...
Yeah.
So that's what I
when
wanted.
When there is a bleeding, I have to use hemamilis along with the eupatorium perforatum. And sometimes when the fever doesn't respond this medicine, I have to use arsenic and cinchona bark also.
Okay,
This is
and
the
you,
pathological condition.
Sure.
The condition of aplastic anemia is not functional. This
Yeah.
is the pathological condition. So
Yeah.
we have to give the several medicines at a time if needed.
so, sir, in, for eupatorium, in 30 potency or
200.
200?
230. I am using
and
230
How often we should repeat that?
every 2 hourly.
Okay, and for how many, I mean, till the time
Two
the,
to 3 days.
Okay.
When platelet increases, then reduce the doses.
sure. Thank you so
Yeah.
much. Thank you. So much.
Okay, most welcome. Most welcome.
More question, please. No problem. We have got 5 minutes to go.
I have a question to ask.
Yes, please come here. That is better. Then he can hear you better. Please say your name and then the question.
Morning. My name is Amin.
Yeah.
I want to ask
Yeah.
you, there's a case of basically ITP, and there
Yeah.
isn't any acute bleeding, but there's a tendency for a child to bleed quite often when he falls down or there's a hurt or rash. So in that case, basically, what is the potency and the pathology that you follow? Because it's not an acute case and there's no often bleeding, but there's only bleeding when there's a hurt. Or
No, if there is no bleeding, nothing to worry. As I earlier narrated that ITP is the condition where platelet goes down, but the bone marrow is functioning. When the bone marrow is functioning and there is no bleeding, no emergency. Just have to observe the platelet count, go with the ferrum fast and eupatorium perforatum. You can give ferrum fast 3x along with the eupatorium perforatum twice a day for few months in 200 or 30 and observe the CBC report. If the platelet increases, then that is the good thing. Only the thing you have to see in the patients, when the platelet decreases or less than 10,000, it may be emergency, and when the platelet lesser down 1,000, it is the critical medical emergency noted in the book. So we have to see the investigation report. You start with the platelet count. You see the investigation report. Start the eupatorium perforatum. Go for the investigation report either weekly or fortnightly, and observe. Once the platelet increases, your action starts. We have to see only the action starts or not. If action starts, then it's okay. You have to nothing to worry. And if there is no bleeding, nothing to hurry, nothing to worry. Don't give much more medicine. Only eupatorium perforatum 200 twice a day is sufficient. But you have to give for 2 to 3 months or 6 months or sometimes 9 to 10 months.
Thank you so much.
Yeah.
Thank you very much. Any more question? Otherwise, Dr. Sharam will continue the program. Any more question, please? Everyone is happy. So final clapping for him.
Thank you. Thank you.
I give you gift when I come back to India.
Thank you. Love to y'all. Thank you.
All right. Thank you again, Dr. Dwivedi. All right. Sorry, I apologize for all the participants on online. We started a few minutes late, but I'm very pleased to introduce you to Veronica, our very dear teacher at the CCHM. For over 2 decades, Veronica has been using her substantial skills in homeopathic medicine to successfully treat people of all ages. Veronica has a traditional European medical education. As such, she underwent all the training that medical doctors in North America receives, plus extra studies. The later included courses in preventative medicine, nature-based treatment, and homeopathy. Such as she studied homeopathy with such masters as Dr. Tatania Papavo and George Vitolkas, Dr. Andre Sain, and Dr. Joe Clarkson, who is the head of our clinical department here, and Dr. Jose Isaac. After graduation from medical school, Veronica has worked in the Ukraine as a family doctor and general practitioner for 10 years. She earned PhD in clinical immunology in 2000 and in 2001, she was awarded the position of assistant professor at the Kyiv Medical Academy, Department of Postgraduate Studies. Over the course of her medical career, Veronica has authored 14 scientific papers in the field of immunology, allergology, and internal medicine. Since moving to Canada in 2002, her career and studies have been predominantly focused on homeopathy. Veronica currently practices in Toronto at Thornhill Naturopathic Health Clinic. Please join me to welcome Veronica.
Hey, hello everyone. Nice to see you all here. Such a nice community who is in the class and online. I'm very happy to be here. So today's I will present two cases of alum cepa, and just wanted to tell that we sometimes prejudice against some remedies. We consider them small, louder. We consider them small and not so important, especially when it comes to the mental symptoms, right? And alum cepa is one of such remedies. So, I want to present two cases here. First case where the mental picture was like predominant and leading complaint, and it was almost like one-sided disease. And again, I was kind of misled by others' remedy, because alum cepa, for different reason, not for mental picture. And the second case where the mental picture was misleading in prescribing alum cepa, because alum cepa, one of the remedy that not proven to the such degree that we have like a mental picture and mental emotional picture is not very complete in the materia medica. Alum cepa considered small remedy. Kent in his materia medica says alum cepa is used principally for colds, and the colds in damp, cold weather. The picture of coryza with acrid nasal discharge, with profuse nasal discharge should be here, and laryngeal symptoms, eye secretion, which is bland, and finger cold. Hay fever, alum cepa is very good for hay fever with fluent coryza, with headache, cough, hoarseness, burning in the nose, burning in the mouth, throat, bladder, and skin. So it's another remedy with burning, like arsenicum, like phosphorus, like sulfur. Modalities of alum cepa are worse in warm room and towards evening, and better in open air. Another affection that alum cepa is prescribed for and has a marvelous power in traumatic neuritis, often met with stump after amputation. So this is another condition which alum cepa is known for. So mental symptoms, if you look in the materia medica of different authors, Borica just give us very short, specially adapted for phlegmatic patients. So not much descriptive here, right? Clark give us very melancholy, fierce pain, will become unbearable, often very anxious, with catarrh, dullness of intellect. Again, it's very vague and not much descriptive. Kent doesn't mention in materia medica no one mental symptom of alum cepa. Herring doesn't mention alum cepa at all in his guiding symptoms, only alum sativa. All other old masters write in their materia medica. So it's suited for violent acute catarrh, particularly of the eyes, nose, and larynx, neuralgic pains, and general aggravation from warm air. This is how we know alum cepa mostly, and prescribe for hay fever and colds. So here is my first case. So the boy, in April 2015, boy is 15 years old. Main complaint was weakness, lack of focus, lack of motivation. He slept like about 15 hours a day, and mother could not wake him up. To wake him up, she needed to pour water over him. He's been always tired. Yeah.
Keep going, keep going.
To do the homework, it would take hours. He needed to make breaks every 20 minutes. So as you see this boy, the mother sent me the picture. It's lazy, sleeping all the time, and no other symptoms. It's like one-sided disease. So sleepiness, profound sleepiness, tiredness, and that's it. So previously, this boy was very active and engaging. On top of school, he's been doing a lot of extra school curriculum. He's played cello, has been doing figure skating, drama club. Now, even to keep up with school is problematic. The situation was developing gradually since a year ago for no apparent reason. The only thing that has changed since then, he's got braces installed for his teeth. There were different explanations in the family to justify his condition. So first, it was like end of the year, and he is tired, and that's why he is sleeping so much. Then it was summer, and summer, it's teenagers, they sleep long all the time, just let him sleep, let him rest. And then school started, and again, he was not able to keep up with the school, and he dropped all the extracurricular activities and started to fail in the classes because of this weakness, inattentiveness, and everything. And so it's a bit cover the not vaccine. Okay, so it was like the top head just disappeared.
You scroll it up.
Just scroll. Okay.
Yeah, there you go.
So anamnesis vita. So it's a life history. He is not vaccinated. Development and milestones are normal. At the age of 6 years old, he had a recurrent sore throat with profuse runny nose. This runny nose was so profuse that mother told that they need to use bed sheets for his nose. So it was so much watery discharge there. He had cough that would start in the larynx and later would go down to bronchi, and multiple times he was treated with antibiotics. Later, he developed headaches, which would appear regularly every month, and nosebleeds. He was treated successfully with homeopathy at the time. The remedy which helped was phosphorus. At the age of 10 years old, was treated homeopathically again due to night terrors, fear of darkness, and stramonium helped with this. And I remember this case because I was trying to investigate where it came from. And again, it was no apparent reason. He just started to scream at night and so on. And stramonium helped at this time. At this point, he had recurrent growth pain at night. And lately, last year, he grown about 10 centimeters. So it's, again, quite another, like I considered at some point, it's a cause of this, his condition might be. So family history: father has recurrent nosebleeds and asthma. Grandfather have had Parkinson's disease. Grandmother, stomach cancer, high blood pressure, diabetes. It's diabetes of old age. It's not like it's insulin. On mother's side family, both grandfathers had tuberculosis. So generals always had been sensitive to both cold and heat, likes to have fresh air, wants open windows, appetite normal, like salty, spicy, sweet, buttery food, juicy food. Favorite food is peanut butter sandwich. Always take out onion from the salad. Thirsty, prefers room temperature drinks. Not thirsty, but normal thirst. During consultation, he is inattentive and indifferent. So it just answer just yes, no, not much going like elaborate on anything. Mentals, generally very sensitive, sympathetic boy, how mother described him. In younger years was afraid of dark heights, being alone, fear of pain and suffering. He was just very imaginative boy. Anxious about family members, about his friends, that something happened to them. Lately, he is more indifferent and not much interest in anything, always tired. So even he's like a characteristic feature in his character right now, just not very prominent, or all come into sleepiness and indifference. So when I repertorize, of course, phosphorus came up and phosphoric acid and all these remedies. So of course I decided this is his constitution, phosphorus, he grows so much, and phosphorus was prescribed with no effect, of course. And then I started to think what might cause. And since in his history, he was prescribed stramonium for this like night terrors, and we couldn't figure out where he get this fear from. So I thought maybe this is the same thing. He gets frightened with something because he's very sensitive boy, and mother just cannot recall it. And again, it was kind of fright, which lead us to the opium state, right? So I gave him opium because it's sleepiness, and so with no effect. And then I started to look for complementary remedy for his constitution, for phosphor constitution, which would have such a sleepiness. And arsenicum album, phosphoric acid, and allium cepa. This is main remedies which would who are complementary to phosphorus and with sleepiness. So arsenicum album I removed from the list because there was kind of no keynotes of it. So I decided to go with acidum phosphoricum because he had grown 10 centimeters over the last year. And I thought if opium didn't work for like fear or something, it would be the cause of this condition would be that he grows so fast. So, and the acidum phosphoricum and phosphorus in this rubric, like general weakness growing fast after, and general growth length too fast in, and general pain growing pain. So phosphoric acid here. So again, it was I prescribed acidum phosphoricum 30, then 200, no effect whatsoever. And of course, allium cepa is small remedy. You think about it at the very least, at the very end. So, and here are rubrics which cover allium cepa, sleepiness, not high degree, like just very, like not second or third, just first degree allium cepa, sleepiness in repertory, and indifference, allium cepa is here as well. And I took the historical symptoms here that was so profuse watery discharge that they need to use bed sheets, like nose discharge, watery and copious, allium cepa in third degree, it's very high. And I put here and this onion aversion. So unfortunately, allium cepa is not in this rubric, but we know that the allium cepa in a rubric craving the onions, right? So it could be like both, like polarity, craving or aversion. However, it is not in the rubric, so probably it needs to be added. So allium cepa was prescribed with marvelous result. So immediately he started to get more attentive, more active energy level. And he was on this remedy for a year, repeated on the relapse. And in a year, he was back to his previous himself, active, lively, returning to his school activities, and everything was pretty much good. And what we see in Allen Encyclopedia, improvements of allium cepa. To mandragora, we may join the excessive use of garlic, onions, and leeks, because all physicians consider them very injurious. as occasion deeply corrupted malignant humidity, which inflame the blood, injure the eyes, the head, the brain, the stomach, predisposing to the lethargy, sopor, somnolency, vertigo, epilepsy, and indeed insanity, even insanity. So insanity, I couldn't find any description, insanity of allium cepa, but we need to keep it in mind, right? That even insanity and epilepsy might be covered by this remedy. Onions go to the head with their acridity and injure the brain. And if one eats too much of them, they can indeed cause insanity and madness. If eaten raw, they make a person foolish by reason of their aromas which mount into the head. If too many are eaten, the onion juice takes away the senses, so indifference here, right? Senseless, by reason of its great heat and acridity. Unexpressible anxiety, turning himself hither and thither, full of despair with severe colic, pains with sore fingers, very melancholy with catarrh. In the afternoon, after wine and coffee, he was completely confused and absent-minded by much business, forgot and twist everything in the utmost confusion on the fourth day. He makes mistake in spelling a foreign language, apathetic in the morning. Working people take it in the morning, onions with bread and salt, but idlers, so make them lazy and make them foolish, melancholy, and sleepy by its use. Cardanus affirmed that even the offspring of those who eat onions freely are disposed to insanity. So it's very interesting. I kind of missed this point. And in Vitukas, Materia Medica, which came up like not far ago, and he gives like very good description of mental symptoms of allium cepa. In its mental emotional sphere, we observe a very interesting picture. Allium cepa has a definite effect upon the brain, bringing about a state of absent-mindedness with much sleepiness. The brain seems to degenerate easily into kind of torpor, especially if affected by some wine or coffee. The mind becomes confused, but it is a completely passive confusion where the patient does not care about anything. He does not observe what is going on around him. It is as he were not interested. Great dullness of mind with definite aggravation in afternoon. He starts making mistakes in his work. He cannot concentrate. He seems confused, as if the mind is under the influence of a lot of barbiturates. Yawning all the time, sleepy and disinterested. In writing, he makes a lot of mistakes in spelling, misplaces words, and so on. But remember that the sleepy brain is the main idea behind the symptomatology. Sleepiness with indifference. This is what we have in our case. This is very much in accordance with the pathogenesis of this remedy, as the onion was known in ancient times to be an hypnagogic and has been used for sleeplessness since then. So sleeplessness treated with onion in the past. It is peculiar that in our Materia Medica, this element is not mentioned in the province. If anybody eats a lot of onions, the first things we will experience sleepiness. Because of this quality of affecting the brain, the ancients were actually afraid of using onions in excess. And again, from Materia Medica in Vitelkas, there is another state to which allium cepa can move, and this is very serious mental state. The patient may look quite well, but suddenly he may have a disappointment or may be offended by something, with the result that the mind is totally thrown out of balance. This is what happened with the boy. It suddenly happened with no apparent reason. Nobody could recall. Like small thing can turn his brain totally like upside down, right? So following this, we see a state of real insanity or total passive insanity, where the brain does not function at all. It is a state that can come suddenly suddenly in a person who was very balanced before, very conscientious, very meticulous in his cleaning habits, with a lot of warm feeling to his relatives, very sympathetic. He really cared about others. And suddenly, this behavior changes from one day to another. He does not recognize the persons he knew very well, before, and it's totally indifferent towards person who live with him, like his wife or his parents. He does not understand the meaning of things. You give him money and he does not know what it is. Never mind how much you explain to him what to do. He doesn't comprehend. So it's kind of like insanity, right? So he sleeps, and it is very difficult to wake him up. He goes from a chair to bed and from the bed to chair and falls immediately in the deep sopor sleep. He's lethargic. When you hear such a story and you do not know the mental picture of allium cepa, you will tend to give opium. That's what I did, right? Onyx machata. But allium cepa fit this mental pathology better. So this is like, again, we have prejudice for allium cepa. It's a small remedy for colds, but it has such profound influence on the mental sphere. Now I will present the second case. It's a patient 50 years old in October. So main complaints were polynosis with conjunctivitis and cough. So no watery nose discharge. It was only eye which were itching and cough. These complaints were worse from May to September. Out of season, eye symptoms and cough continued, but on the lower scale. Eye itchiness, burning, aggravated inside of the house, better from cold washing. Cough, dry, from tickling in the throat, painless, worse online, worse in evening and night, worse in warm room, and worse in cold air. So both warm and cold air. So other complaints he had: frequent urination during the day and twice at night, usually painless, feeble and forked stream. Incomplete urination, he needs to come back to finish like a few times. Back pain in the sacral area, sensation of weakness of the back, standing, repose at the beginning of the motion aggravates, better on lying down and better after walking sometime. Periodic high-pitched noise in the ears. His habitus, height 6.1, he's quite tall, and weight 210 pounds. So it's stout complexion, so it's tall and big. So past history and family history. In past, he had periodical skin eruption in form of urticaria, allergy to dust, to cats and to dogs. As a child, he had frequent colds and had pneumonia. At age 26, had urethritis treated with antibiotics. Family has no allergy in history, but his son and daughter both have allergies. So you see this allergic constitution started with him. But he didn't have this predisposition, but he gave this predisposition to his children. So general temperature, both heat and cold, tolerates good. Appetite is good, tolerates all food, watches what he eats, tries not to overeat, was trying to lose weight because he's like stout and big, was trying to lose weight, went on a diet, weight drops 198, but he doesn't feel good when the weight is lower. There is no preferences or aversion. Eats and read only healthy food. Eats onion and garlic because it is healthy. Avoids sweets, carbs because it's unhealthy. Thirst, prefers warm drinks 2-3 liters a day, not because he's thirsty, because it's a good for health, very like health-oriented guy. Sleep, waking up for urination usually after 2 a.m. Sorry, it's not p.m. 2 a.m. Oh my God. AM. Oh, it doesn't want to. Okay. So the mental picture, very proper in eating. So look what he eats, in behavior, in lifestyle, follows healthy diet, regularly exercises, religious, not excessively, he says, not excessively, but every Sunday goes to church and it is routine. So routine is very important. He follows it. It's like religion for him. Follows all this religious fasting because it is healthy. Again, it's explanation about healthy, responsible, rules and routine oriented, likes others to follow rules, very fastidious about the food, about the language he uses, no swear words, and so about the behavior and his appearance. So, and has give me an impression very proper, tries to be righteous in everything, in lifestyle, in diet, in thoughts, speech, behavior, very dogmatic and rigid, likes to lecture others about diet and behavior. But he didn't impress me like he is domineering or wants to be higher of others or something. Very kind of friendly guy, but very righteous, want to be right in everything and be good. No fears or anxiety. He just expressed like fear of the family members, like because today's it's all this all around. Fears only God. So this is how he explained. Again, not excessively religious, but still going to church and everything. So here I put the only local or particular symptoms here, eyes and cough. And you see the allium cepa coming up very high, like on a third in the repertory. And of course, sulfur pulsatilla is here. But you know that the polynosis, it's a chronic condition, right? Chronic condition, and can't give us some insight of the treating polynosis. You may know that the true nature of hay fever is not generally understood. It is really only an explosion of chronic disease. That is, it is a manifestation of psora and can be eradicated only by antipsoric treatment. Many times I have seen hay fever wiped out in one season by a short-acting remedy, only to return the next just the same. And perhaps another remedy will be required. As soon as the hay fever is stopped, you must begin with constitutional treatment. So I put all together like totality, and when we treat chronic, not acute, we take like all totality, and of course mental symptoms we value more than general symptoms, and particulars go at the very end, right? So and when I put into totality, so this pulsatilla sulfur again very high, lycopodium kali carb, and allium cepa is only on 28 number here, right? So again, I was looking not like temporary relief, like Kentas teaches to search the chronic deep acting remedy, and including the all mental picture. And after the repertorization, beta system give us the kali carb number 1, then pulsatilla, arsenicum, and kali bichromicum. So what I want to point out here that kali carb, it's a kali group. Pulsatilla also kali group. It's a kali, it's a plant of kali, an analog of kali sulfuricum, right? So, and kali bich again is here. So I decided, and it was like end of the season, October, so I gave him kali carb 200 based on repertorization and mental picture. Mental picture fit very well kali with rigidity, with routine and order and everything. So, and no change in the symptoms of polynosis, some positive dynamic on the back pain, like 20%. So I decided double dose, 200 double dose. And in follow-up in January, little improvement in itchiness of the eyes, about 20%. Patient went to vacation to the ocean and came back with aggravated symptom of urethritis. Frequent painful urination with burning in urethra, old urinary symptoms like forked feeble stream, incomplete urination, need to come second time. And at that time, when I was questioning him about the appetite and food preferences, he was kind of describing in very detail how he cut the onion and garlic in small pieces, eat it with pleasure. So I just kind of, it's not just healthy, not just for health, probably he like it. So he craving the onion, not just because he wants for health, like eating this. And so I decided to put into the repertorization and these acute symptoms of bladder, of the onion desire, garlic desire. So tuya, of course, this feeble and forked stream is very peculiar and very characteristic for tuya. So the tuya came out quite high, and allium cepa is over here and very like far, but still present. So tuya was given. And I put like general, total with mind symptoms, with generals. So, and the tuya like 64 on the 3rd degree, and the forked stream like lead me to the tuya. He received tuya and follow up on February, symptoms of burning during urination, 80% better, only occasionally. Frequency is the same. Stream during urination has improved. Back pain improved 50%, polynosis improved 30%. So repeat the tuya. It's such a good kind of result. And in April, he came before the season. The season starts in May. And symptoms of eye itchiness with burning are still there. Cough still persists. Urinary system are almost gone, only frequent urination during the day, but not at night. Back pain improved. Only occasionally he experiences weakness sensation. And desire, onion, garlic are the same. So I took the case, put everything in repertory. So again, sulfur lycopodium pulsatilla here, kali carb. So I took off mental symptoms. I decided something is wrong here. So I don't see the remedy which would work here. So I decided just took the mental symptoms from repertorization. And again, allium cepa is on a second place. So, and it's season coming. So I decided to go with allium cepa because like during acute season, acute polynosis, you need to might be using acute remedy. So, and Vitukas said me allium cepa as well. And again, you see causticum, it's kali remedy, right? Again, pulsatilla, kali remedy, kali carbonicum. So it's all around kali group we are playing here. So, and follow up on the phone in June after this allium cepa 30C, 3 dose, evening, morning, evening. So patient reports that within first week after the remedy, all his symptoms got worse. Polynosis, it was still April before polynosis season. Frequent urination, aggravated. Burning during urination, which tuya was taken care of, right? Again, came back. Forked stream came back. Back pain came back. Noises in the ear, all aggravated, all the symptoms. It lasted about a week, then started getting better and better. And his cough is gone. Eye symptoms are better, 90%. Urination and back pain improved. Noises in the ear improved 50%. Last week, itchiness got a bit worse. So it's in June. So I gave him allium cepa 200. So it's such aggravation, good reaction, right? And so after this, summary, he came like in end of the season, and then during 2 years, 2017-18, patient has been receiving allium-cepa on every relapse when his itchiness and cough would come back, with good result in potency 200, 1M, 10M. On 10M potency, he got aggravation again, this following amelioration. All his polynosis symptoms during the next seasons were mild or almost nil. Without season, they were not disturbing him. Noises in the ear are gone. Frequent urination and fork stream are gone. Even on a mental, emotional level, patient reports that he is more relaxed about his routine. So his wife said, so he can skip the Sundays sometimes. Like this, you know. So it's interesting, all this observation, and you see, when we see this mental picture, so like a podium, of course, but not much keynotes of like a podium to prescribe. So Kali, very good, or very fitting in the picture of mental picture of this case. So, and if we look into the biochemical onion nutrition, so look, the phosphorus, which is complementary to allium-cepa, and potassium is even more present in the allium-cepa. So you see, it's probably we kind of, when the allium-cepa was proven, all this picture like ritos, really going to the church, being too proper, it was like good feature. It's not, it wasn't like something abnormal, right? Today, it looks like almost strange, such ritus and religious and praying, and so that's why I took this as a symptom. So that's why probably during proving, Henning was proving the onion, and he probably considered this as a normal, not pathology at all. So that's why I was kind of misled. And what I want to say at the end, that the possible that allium-cepa is not so small acute remedy after all, like Kent states, so only good for colds. And you see in these two cases, one is totally one-sided mental case of this boy, and was showing great result. And it showed that the allium-cepa remedy that not fully proven, probably it's required more proving and investigating of the mental symptoms. And probably it's just my kind of conclusion after this remedy that mental picture might be similar not only for phosphorus, which allium-cepa complementary, but also to some Kali remedies, Kali with its rigidity and dogmatic and routine oriented, which need to be again confirmed by other cases. So if your dear colleague, you have anything to add here, and if you have any experience, I would appreciate, and it would be very helpful to understand fully the mental picture of allium-cepa. Okay, so this is it. This is what I want to. Okay.
Thank you, Veronica. Can open the floor. I'm sure there are questions from the group.
Oh yeah, I can stay
You can
here.
stay.
Yeah, any questions? So everything, yeah.
So the first case was more of a psychosomatic, if I'm not wrong. I mean, psychological.
Yeah.
I mean,
Mental, mostly
yes.
one-sided mental. Yeah.
One-sided.
Mhm.
Okay, so, and the second case was more of a physical symptoms you considered, right?
Yeah. But the complaints were mostly about the physical symptoms like polynosis and urinary troubles and so on. So he didn't complain about mental picture, but it was striking, like strange, his like mental setup, right? It's the same like with phosphorus. We have like mental setup, sensitive, sympathetic, and so on, that here again, so I was trying to prescribe proper remedy for the person per se, not for the symptoms of polynosis.
I mean, you were taking a holistic approach, if I'm not wrong. In the first case, it was more prominent to take mental as well as the physical. is more of a psychosomatic, which I understand, like mental symptoms were given priority. That's what the presentation is about, right? But the second case, I'm a little confused that when we took repertorized it before, consulting the Vithalcus expert, I'm using Vithalcus. So I understand that, when I do that, sometimes it becomes confusing. That do we have to eliminate the mental symptom? Means why did you?
Why I am eliminated? Because when I at the end I put the totality all together. Again, it was the remedy that I already given him, right?
Yeah.
And it didn't help, and I wasn't satisfied with the result. So that's why I decided maybe it's mislead me somehow.
Okay, so just one question. I don't know whether it's logical. Did it strike you that you should be taking mental symptoms only and eliminate giving the secondary importance to the physicals?
So
we could have done the other way around.
So you when you are resolving the case, you can play as much as you can to give the weight gravity to either mental or so this is what the beauty of homeopathy is lies. So then especially if in materia medica we have many remedies unproven and we don't have like complete materia medica, so that's why I had such a difficulty. If, for example, with Allium Sep, I had some mental picture like that belongs to Kali, right? So it would be much easier.
Out of curiosity, I would definitely, after going from here, I would definitely want to repertorize it on the basis of only mentals and discuss with you further on.
I could add a couple of things. This is actually a very good case to see that.
Yes.
It's when you repertorize. If you use a lot of mental symptoms, I'm sure that the polypers are going to always come and overcrowd your.
Yeah.
So it's better to, if you use your mental symptoms, put it in one clipboard and put your physicals on a separate clipboard. You can always see them together, but then always pay attention to the physical, because often the physical, most of the time, the physical is going to guide you to the remedy. But the case of Paganum harmada that I presented to you, if you do physical, it will never show. Like on the head symptom, I mentioned to somebody, it has only 2 rubrics in the whole repertory. You will never be able to. But if you look under the rubrics, delusion being cursed, then you will see Paganum harmada there. Then you have to pay attention to.
This case has really opened my mind towards the, Allium Cepa that.
So what is very interesting, and if I can say a few things about Allium Cepa, Allium Cepa belongs to the lily family. All the alliums are lily family. They are these bulbs, and they're very. You can pull them out very easily. So they're very fragile remedies by nature. In that group of remedies, Veratrum album. Veratrum also belongs to the lily family. Veratrum is a very religious remedy. Another thing that is quite well known with Veratrum is this attention to details. When they take papers and they cut it into pieces and pieces and pieces. So because that actually belongs to that group of the. So here, the religiosity that looks like Thuya, it actually belongs to the lily groups. Veratrum is like that. This detail to attention belongs to. So if you think of Allium Cepa and you see that, and you say, is this Allium Cepa or Thuya? If you think of Veratrum, you say, oh, it belongs to the group. Therefore, I could use the mental symptoms, now depending on which one you use and things. So if you presented a case and you take the mental and Veratrum shows at the 5th, and Allium Cepa is there, but it covers better the physical, then you're in the right group of family. The other thing I should add in the lily family, the idea of being rejected by the family or by the surrounding is very, very strong. Anytime you suspect that, you need to question what is the inner core of the person? How do they see within their friends at school? How do they feel themselves within their family? If you want to get the core emotional state, you have to go to the physical, as I showed you with Paganum, and then see from there whether the rejection comes out, whether being squeezed out. When you squeeze any of this in the whole lily family, the idea of being squeezed out is very big. When they describe their headaches, when they describe their nose, it's like something is pressing and squeezing things out of. And allium and garlic are very irritant, as you know. These people are perceived as irritating people around them as well. if you can get those symptoms out, then you can use those mental symptoms and the small remedies will come up much bigger.
Oh,
But
thank you very much.
thank you so
It's
much.
an insight that I didn't think about. Paganum and Alim Sepa is one group. It's very that's where religious kind of things comes out. So it's interesting. Thank you very much.
Yes,
Yeah.
you're very welcome.
Okay.
I'm going to take a short break. Thank you again, Veronica. That was a very wonderful. Many looking at different features of a small remedy. That's again, there is no small remedy. It's our mind that makes some remedies smaller than the others. Onion should be a big remedy because it's part of daily life in every culture. Just as is natural muriaticum and small. So we'll take a short break. Well, it is, thank you, everyone. Thank you for being here. It has been a wonderful day so far. It's my pleasure to introduce you to Dr. Sharma. Around a year ago, I think I received an email from him this interest of having a joint conference here in Canada. So we owe today to Dr. Sharma's initiatives by sending that email and saying it would be a good idea too. And we've worked together ever since and made this happen. So thank you again, Dr. Sharma.
Thank you, sir.
For also bringing to us wonderful speakers to the group. It's really enriched the quality of the day. So Dr. Sharma, he has completed his 5 years full-time homeopathic education of Bachelor of Medicine and Surgery in 1972 from National Homeopathic Medical College and Hospital in Lucknow. He then joined SAV Hospital, Ludhiana, as medical officer in charge. He also joined as lecturer of organ and of medicine at Lord Mahavira Medical College and Hospital, Ludhiana. Later, he was appointed principal of the college, which continued till 1985. Dr. Sharma has authored homeopathic card repertory, which is the second largest card repertory in the world. This repertory has released by the President of India at President's House, New Delhi in 25th May of 1985. In 88, Dr. Sharma migrated to the United Kingdom and started his homeopathic practice at Slough, Berkshire. In 96, Dr. Sharma completed his physician general, is that what?
PG Home London.
PG Home London, and started teaching organ of medicine and homeopathic materia medica at Hahnemann College of Homeopathy. In 2008, he was appointed principal of the Hahnemann College of Homeopathy in UK. Currently, Dr. Sharma is the director and principal of the Hahnemann College of Homeopathy and continue his homeopathic practice at Slough, United Kingdom. Please join me to welcome him to his lecture. So,
Thank you, sir.
So your presentation is this one. Is that the right one?
Yeah, that's the one. We can start from the beginning.
And this is the beginning. Just let me share the screen and then I'll come back to this. So let's see if I can take this out or not. That should be okay.
We can do the slideshow from here. And from the beginning.
I think if I just click here, where is this here? I think there, yeah. It should be already good. Here it is.
Thank you, sir.
Oh, but not in here though.
It's
Not on your screen. Let's see here. Here it is.
Thank you, sir.
It will show you your next slide here, but they see only this.
Thank you, sir. Good afternoon again. It was a really wonderful day until now. I will try to be short because it is already 4:15. And today I'm going to tell you the importance of the mental symptoms in homeopathy. The importance of mental symptoms in homeopathy. Why? We are the only medical science which is governing the mental field of treatment. There are so many good doctors around the world. I respect them for their work and contribution for the health. But no one is better than a homeopathy doctor. Yes, I'm very confident. I told this at the Royal College of Medicine and they were shocked. I said, I am not insulting you, but you don't know what we are, but we know what you are. Understand? Just like 2 languages, international language is English, but our country has got 265 languages. If Dr. Nanda Kumar is speaking something from Kerala, I don't know what he is talking until he will tell me English. So homeopathy is the wonderful science. We owe everything to the master, and master got this divine science by the help of the God. You know that? When he did MD and he was not happy with the practice of that time, he gave up practice. He was translating the books. And while he was translating the Kullas Material Medica, the story, you know, I don't want to repeat and waste time. Then he said, how is possible? The quinine is good for treating malaria. How can it produce the symptoms of malaria? He took some doses. He took 4 weeks and he started developing a symptom, but his blood was negative. That time, medical science was not that advanced of selecting the blood tissue and all this, but he definitely knew he didn't have the malaria, but symptoms were there of agu symptom. So China, the Peruvian bark was proved on himself. Here, before I start, I've got a message from VIP, and I respect him. Why? Because he is the great grandson of Samuel Hahnemann. The patron of Hahnemann College of Homeopathy is Mr. Charles Tankard Hahnemann. When I told him, sir, I'm going to Canada, please say your words or something or send your blessings. So he gave very small, beautiful message for all of you. We are one family. Doesn't matter you are from which country where you was born, but we are one homeopathic family. So this message is for you and everyone. He said, I am pleased to know that International Homeopathy Conference Toronto, Canada is being organized on 23rd April 23 at Toronto, Canada by Canadian College of Homeopathic Medicine in collaboration with Hahnemann College of Homeopathy, UK. I am informed that speakers from the both institutions will present scientific papers. Dr. Veronica, he knows everything what is happening here. And there is another lecturer, Resha, I think. So he said, I am informed that speakers from both the institutions will present scientific papers on various topics. These type of events are good for learning and practicing classical homeopathy. Okay? No homeopathy, no this classical homeopathy. Homeopathy always works. Note this point. Homeopathy always works. What a confidence. If it is practiced based on the principles and teachings as instructed by Dr. Samuel Hahnemann. There are a lot of doctors, they say, I'm homeopath, but they are not homeopath. I should not tell them about the mongrel thing. You know all what is the mongrel thing. They're saying, I am homeopath, but they're not proper homeopath. They're mixing medicines. They don't know the one case of eczema needs clematis, graphitis, sulfur, arsenic. They mix everything. That's homeopathy. Homeopathy was proved with a single remedy, and it should be prescribed as a single remedy. In my 51 years of homeopathic practice, I never mixed 2 medicines. Sometimes I used to give one remedy in the morning and one in the evening, like sulfur and naxunka, very good combination, not for too long. The single dose, single remedy, there are hundreds and thousands of doctors around the world. And in India, there are so many classical doctors, only 1 dose. If you're okay, okay. If you're not okay, then go to someone else. We are not money maker. We are continuing the mission of Hahnemann. He said, I extend my sincere greetings. Doctor, I extend my sincere greetings to all attending this event and wish you all the best for the special effort for promoting homeopathy. So you are promoting homeopathy, not me, not Dr. Sharma, but everyone who is working and treating and curing the cases. They are promoting homeopathy. Charles Tankard Hahnemann, 17th April 2023. It was about 6 days back. So, thank you, Dr. Sharam for helping me. And I feel like I have a brother in Canada now. So today my topic is importance of the mental symptoms. What are the mental symptoms and why they are more important? My lecture will be only short, no, I won't go extra time. It is very important as these direct us in selecting of a proper simillimum. There are 3,300 remedies in pharmacy, but there are more now, but I don't treat like a Berlin wall, marble, this drama. They are rubbish. Pure homeopathy is from the six sources. Vegetable kingdom, animal kingdom, chemical kingdom, no sorts. She's counting. What's your name? Very good. Which one the next one? Sarcoats, no sorts, and imponderabilia. The sun, X-ray, light. These are also a type of measures. Solar light, moonlight, Luna. Soul is a solar sunlight. You know soul? Yeah. It's very good for itching in the sun and all that. So I won't go there because mental symptoms and homeopathy are very important as these direct us in selecting a proper simillimum. When you are confused between two remedies, and suppose there is a remedy arsenic is there, so definitely the symptoms of arsenic, he will think maybe I will be treated well or not. He's not confident. He's hopeless. Maybe, no maybe. Arsenic album definitely will have the symptoms of hopelessness and feeling of insecurity that he won't get better. So there are many important mind symptoms. Not only one, there are more than 367 rubrics top. But without wasting time, because it's a short lecture, so I'm telling you which are most important ones. Just like this Toronto is very popular, Vancouver is very popular. I don't want to go to very small towns here, like Hamilton and this and that and London, see. So important symptoms have got agony, anger, anxiety, brooding, confusions, contradictions, cruelty, depression, egotism, emotions, fear, hatred, imbecility, impatience, irritability, lamenting, laziness, maliciousness, mania, moods, offended easily, quarrelsome, rage, restlessness, suicidal, sensitive, so many things, startle, where people are, oh, like this, what happened? Yeah. So today we shall elaborate one of the most common mind symptoms, most common. You won't see all the symptoms generally. The most common is fear. Today we learn about the fear. And I'll make you the PhD in fear today. Okay? What is the fear? Fear of accident, alone of being, animals of, approaching of others. Somebody coming there fearful, yeah? Behind him, somebody is behind him. Betrayed of, black, everything black. I can't tolerate black, yeah? Bridge crossing, business, cancer of, and causeless. There is no cause, but fear. What's wrong with you? No, I don't know. What's wrong with you? No, don't know. Only homeopathy can treat, no science can treat this. I challenge you. I will stop practicing if you prove that anything is better than homeopathy. I tell you, about 6 years ago, when I got admission in National Medical College, my father was living and next door, there was someone. He said, oh, where did you got admission to your son? The very small pills, the sweet pills. And after 15 years, he got his son admitted in another medical college. What a surprise. He was criticizing homeopathy sweet pills. But after 15 years, his son was studying the same science and there's a city called Bhopal. So people sometimes learn very late. Sometimes people don't believe in homeopathy. I don't believe in homeopathy. Forget. Tell me what is the problem. Forget homeopathy. You want to get better or not? Yes, sir, I want to get better. All right. I give you a glass of water. What do you do? I'm just getting, I give you water. Are you thirsty? Yes. I will take the remedy in my pocket. Go to my water. One drop there. Drink it. Honestly, I said, drink it. Then we get better. So, sorry, I'm a bit thirsty. I get a water slightly.
It's a remedy.
For himself.
I won't drink that water.
This is only water, nothing else.
We can trust you.
I know there is one doctor from South India. He came to lecture. And it was lecturer at the University of West London. He said, bring me. What he was drinking? Whiskey in water. I give his name, Dr. Ramchandran. I said, why? He said, this gave me power to speak. So this is also a mental symptom. When you can't face a crowd, when you're not very confident. So here, causeless and fear in children, closed eyes, closing eyes on, cockroaches, contamination. Then you people say, like just don't touch me, yeah? Keep away, yeah? Contamination. Control of losing. My company will be taken by someone else. Somebody will control me, yeah? And then convulsions before and crowd. Crying with, fear with crying. Cutting himself by shaving. When he's shaving, he will fear, he will cut himself. What a special symptom it is. No one can treat in the entire world. We are the supremo. Honestly, and fear of dark, death. When they go to dentist, is a fear. Dentists even don't know. We know if somebody is visiting them, how much fear they are. And then diarrhea from. Diarrhea, fear. Where is rectum? Where is mine? Is it linked? Yeah. Then disease of impending. Oh my God, I will have some disease. I will die. Yeah. Destination of reaching. Just like this morning, we were late. There was an accident on the road, 40-minute delay. Mr. Singh, I'm sorry to tell you something. He just went out because his wife fell down and she's injured and he's in the hospital. That's why Mr. Singh left. Okay. We pray for their health. And doctors are going to doctors. They fear doctors. I don't want to go to doctor. And dogs are very common. Evil of. Happen, something will happen. This happens generally with the ladies when the kids are out and they late. Oh my God, something will happen to him. He's late, he's dark. Yeah, very important remedy. Imaginary things, insanity of men of or people, misfortune of people of poverty, robbers of, water of, and then work dead off. A lot of people, they don't want to work. I can't work, I fear work. So, this is the only science in the world which controls the mind as a 100%, not even 99.9, 100%. I will give you a case, young man. I started loading his video and I loaded it on the YouTube, but I can't find where it is because there are so many YouTube very similar. I don't want to show you some silly. So Mr. Gulati is only 24-year-old young man, anxiety in the crowd, and he was smoking weed. Weed is a drug. You know weed?
Yeah.
He smokes weed and he drinks alcohol. He desires sweet. Urging for stool after eating 3 times a day, morning, afternoon, just like a regular habit. When he eats something, he go to toilet. He eats and go to toilet. Dreams horrible, nightmares, dry cough, negative thought, scared feeling, scared feeling. Scared feeling is always scared. Ah, something will happen to me. Something happened to me. Yeah. Then jerking during sleep and crying in sleep. Very important symptom here. His sister was sitting next to him. I said, sir, he's crying in the sleep. Why he's crying in the sleep? He's sleeping. That I took the symptom, body ache and weakness and lassitude. And then remedy was prescribed, natrum mure. Because remedy was a dead sure single remedy out of 3,300. Natrum mure, I gave 10 ml, 1 dose. Why I give 10 ml? Because I was a dead sure 1 dose of hypertension will work. Suppose you are going to buy a car in the market. Yeah, any car, maybe latest car or any, and you take some money and the money is not enough. Then you will go back and bring more money. Yeah. He says it's not enough that you bring more money. Understand? One lady doctor from America, she was traveling in the train with some high potency medicines. The co-passenger was suffering with some illness. And she had only 10 and 50 medicines. The co-passenger required a remedy. Next one. It was the late time in the train, yeah. And she only had the 10 so she gave the 10 one drop. Oh, we have very high 10 50 CM, DM. I never saw aggravation because when you have the controlled treatment, there is no aggravation. I confirm. When there is a controlled treatment, the symptoms are there, the channels are there, the remedy will go in the channels. And it is most effective homeopathy result with the high potency. Dorothy Shepherd. Have you read the book? Magic of the minimum dose. Please buy book from somewhere and see what she is doing. I was giving 30 to 100 when after the reading, but I don't give to everyone, but the Dorothy Shepherd's book, Magic of the Minimum Dose. Okay. So if you're buying a car, you're taking $10, no, $100, no, $20,000, no. The car worth is $45,000. Even $44,900 is nothing. You have to exact money. So that's why we have to give the high potency. Okay. So it was 11th of Feb 23. I gave Netromio 1 dose. And because what he will believe, there are two sides, psychological side and financial side. Nobody give you money after for 1 dose. Honestly. So I gave Seclec pills, globules, yeah, saturated in the plain alcohol because they smell. There's no smell of the medicine, it's the sweet pills, you know. When they smell alcohol, yes, there is a medicine. So Seclec 30 days, and gentlemen, it reported a lot better. And Seclec 30, again, prescribed on the 25th of March. 1 dose, Netromure, 10 I owe this information to that guy and Dorothy Shepherd teaching. I was not worried. And now, second dose case, DK is a lady. Very funny lady. That's why I selected. I had a video from that lady as well. And the gentleman is missing here. It's already 3:30, so we'll finish in 10 to 15 minutes. Occipital pain and weight in the vertex. Where is the vertex? Can anybody tell? Anatomy? Yes, doctor is MBBS. Yeah. A lot of doctors don't know where is the temporal region, where it's better to know. Yeah. So she had occipital pain here and weight in the vertex and menses late and suppressed. Large varicose veins, legs, she said. Anxiety since 8 years in the evening. In the morning, I'm fine. In the evening, I feel very anxious. I always take a case as a whole. A lot of people don't know what is the difference between a totality of symptom or totality of a symptom. Can somebody tell me what is a totality of a symptom and what is totality of symptoms? Please tell me.
Location, modality, and concomitant.
But you are the great boss. I know, but I'm asking my friend. You know everything. Yeah, please.
Yes.
One thing you're missing. Onset.
Etiology.
No. Onset.
Onset.
The beginning. What time is that? Onset.
Okay.
Location.
Yeah.
Okay, thank you. So she had anxiety since 8 years in the evening. Anxiety built up bunches of delusion and hallucination.
You need to share your
Yes.
screen again one
Yeah.
more time.
Yes, what will happen?
I think since we got disconnected.
Hmm.
Here's the share screen. Let me share screen.
What is going on?
I think nobody else, people in the class are seeing the screen, but not people online. So here's Zoom. And how do I stop this? Then I escape, it doesn't come out. Oh, here it is. This is gonna work now.
Thank you.
Not sharing it yet.
No, it's gonna, now I can do it. I have to go here. And now share it by. Here.
Share screen right there. No, do yeah, that one.
Sorry about that. Here we are. I'm just going to close this. And do this. All right.
There we go.
Thank you, sir. Thank you.
You're so very welcome.
So anxiety since 8 years in the evening, and anxiety again, delusion and hallucination, sees faces and images. A long time we see a lot of symptoms in the cancer repertory, but we never see. But that was a very good case. She said, I see faces here and there. I see images here and there. Luckily, I found something, yeah. Never somebody reported. You can't get the very special symptoms, very particular, peculiar symptoms. But this symptom was very important. Confusion, walking while. She's confused. She's walking which way to go. This way, right, but she's always confused. Even she coming into my office and she's confused. This is the door, please enter here, yeah? And then very irritable. Mostly in the evening time. Anxiety with fever mostly in the evening. See the aggravation time evening. Impatient, talk of others during somebody talking. So she won't allow anybody to talk. She will not even complete other people to talk, yeah? Not only her. Her sister is very similar. Her third sister is also, all the sisters are the same brand, okay? So the most important symptom is repeat the question first, then answer. Then I asked, how do you feel now? Then she said, how do I feel now? So she will repeat the question first, then say. Everything okay?
It looks like some people don't say this, but this is going to work better this way for some reason.
Okay, no
Are
problem.
you able to work?
Is okay?
Yes, perfect.
That's okay then. She was repeating the question, then answer. Then I said, how are you feeling now? And then she said, how I'm feeling now? I'm feeling better. So do you want to add something? Yes, I want to add something. Yes. This is the symptom. Very minute symptom. You should note what somebody is saying. And this remedy is very special remedy. It will come in the end, yeah. And talkative, loquacity, very restless, anxious, aversion to work, indolence and sadness. She don't want to do anything. Very sensitive noise too. Mistakes in speaking. When what she is speaking, she makes mistakes. I'm asking something and she is telling me something. She makes the mistakes. If I ask, are you happy? I say, I'm thirsty. Well, what is happy and thirsty? No link. If I'm asking, how do you feel? And she is telling something else. Mistakes in telling even. This is a special symptom. Mourning for fee. Doctor, 50 pounds, too much. I said, you are giving me case and looking at the fee. Because legally we have to put the fee there and medicine charges. So she's talking to me and she's very clever. She said, Doctor, your fees is very high. I said, first finish the case. I want consultation. I said, first finish the case, yeah? And then very sensitive noise, speaking, and changeable and variable mood. Sometimes she's happy, immediately she's changed, changeable and happy. Because when you're taking a case, your mind is running around here, there. One symptom, Palsatilla, one symptom, this. Never make up your mind until you see the last symptom. There was a guy, he took the treatment from me, I gave and said, you have to observe the dieting. He said, what dieting? Please don't take raw onion, garlic, spice, mints, chocolates, and coffee. He said, I don't do all these things. I said, very good. Then why he's going, I only smoke weed. Oh my God. The last thing was killing everything. I was thinking he's a very good man. He's not eating raw onion, garlic, spice, mints, chocolates, and this. And he's smoking weed. So this is the last symptom is very dangerous, yeah? And religious and despair. She's a sick lady. She's going to the sick temple and she's very despair. What will happen to me? But all her problems are during menstrual periods. She is nearly menopause. Her name, DK. DK is a very special name, but I tell you, Dashmesh. Dashmesh is the name of a guru in Sikhism. Yeah, Bhakti ji knows, I think you also know. So, homeopathy treatment was ginkgo metallicum 30 only. Because she was very sensitive, never give hypertensive cells to people. 30 pregnancy, 3 doses for 5 days. Then Seclac 6 till 3 for 20 days. On 4th of the March, she said, I'm feeling better, but I'm not fully better. Again, she was mourning. Last time I gave you 70 pounds. I said, I'm not talking about the last time. Tell me about now. Because I gave 10 pounds discount. My fees is 50 pounds, 30-day medicine, 30 pounds. So rather than 80, I charge 10. She was happy, 10 pounds minus, yeah. Feeling better, not fully cured. So what we will do? Not changing the remedy. Ginkgo made 202 doses at 10 minutes interval, immediately. 1 dose now, 1 dose after 10 minutes. I use original medicine from Bilmer Shabe. Because if you give the remedy is not the same. Is your name is gone into bin, yeah. And then Seclac for 30 days. 6th of April, she came and she said, the last medicine was good, but I'm not fully cured. You're giving me not a good medicine. I said, today I give the good medicine. No worry, I gave Ginkgo at 1 and 2 doses and Seclac for 30 days. 9th of May was her appointment. She never came. She rang me. I don't need more medicine. Please send me my invoice which I paid you. I'm claiming from the insurance company. I said, thank you very much. I send you the invoice. So this is the case. Now we go for I've got a few minutes left. Some up research for you, especially for you. You can make a note. Dark remedy for the dark is cannabis indica and stramonium. And for the death, aconite, arsenic album, calcarea carb, simicifuga, gelsemium, lacanum, nitric acid, phosphorus, and platina. Death when alone, fear of death when alone. Arsenic album, argentum nitricum, and phosphorus. During labor, aconite and coffee agruda. Dogs, belladonna, china, causticum, hyoscyamus, and tuberculinum. Happens something will. Causticum is the top remedy. Then phosphorus, arsenic album, calcarea carb, carbovage, iodium, kali ars and kali brom. Natronure, onosmodium, very special. Phosphoric acid and tuberculinum. Imaginary things. Belladonna and phosphorus. Misfortune. Chana sulf and sorinum. Poverty, I will be very poor. Something will happen. I will lose my business. Brynia, calcarea carb, sorinum, and CPR. Fear arising from stomach. The mind is here, but fear comes from the stomach. Very special remedy. Their mind is here. Fear arising from the stomach. Miserium, top medicine. Aurum, met. Calcarea carb, cannabis sativa, digitalis, kali carb, lycopodium, and phosphorus. And another thing is very common, thunderstorm, phosphorus, natrum carb. Other remedies are natronure, nitric acid, rhododendron, and CPR. Water off, just like a dog biter, hyoscyamus, lysine, hydrophobium they call it, stramonium, belladonna, lakhs, and phosphorus. Work dread of, they don't want to work, fear work. I can't work. Angentum nitricum, calica, passerella, silicia, and sulfur. And special remedies for fear, special remedies. Morning waking on fear, first remedy is passerella. Which time of the day? Morning remedy, Pasatilla. Twilight, when the lights are evening and morning, the two lights are on. Very important, Pasatilla, Calciraka, Castricum and Phosphorus. Night, camphor is the top remedy, and then rust ox. Animals are, people are thinking of belladonna and all that, but this animal, all type of animals, is China and stramonium. Approaching of others. Don't come near me, don't come near me, I will get hurt. Arnica, top medicine. Even after injury or without injury, no, don't allow. Sometimes I see people, they say, oh, don't come near me, don't come near me. Arnica, top medicine. And then betrayed of being. Somebody will betray me, Hyoscyamus. Crowd, people don't know about this thing. They go for gelsemium, but aconite is more important than gelsemium. With a big crowd, oh my God, this big crowd. There's so many people, how I will go, how I will cross the road. You understand? Aconite. Crowded places, gelsemium. Thank you very much. Finally, there is a small note. I got 5 minutes. Anxiety at 3 a.m. Special 3 a.m. Can somebody tell what the remedy?
3 a.m. Calica.
Thank you, sir, but not Kalika. Please, don't mind if I am correcting you. I give you $10 if you tell. $100. Dr. Shah will give you $2,000. Oh, sorry, very, very sorry. That's like a family. The best remedy is arsenicum album. You need that. You lost $10,000. Oh my God. Anxiety alone when? I'm going to finish in 2 minutes. Anxiety alone when? Yeah. Yes, I will buy you coffee this evening. Yeah. Arsenic and phosphorus. Now, very important symptom. People don't close their eyes. They are fearful. They want to wake whole night. When they close their eyes, oh, tell me the remedy, please. No. No. $5 only. Anxiety closing eyes on is a wonderful remedy. Parvo vegetalis. I leave this paper here. If somebody challenge me, I will stop practicing tomorrow. Because this is the great research done for today. When you go somewhere, you don't tell the silly stories. You go specialist, yeah. And when I finish this, I tell you what are the special stories, yeah. So, anxiety house in Lycopodium Pasatilla rustrox. Anxiety pressure on the chest, which remedy? Please, sulfur. Anxiety riding while, borax. Anxiety storm during thunder, phosphorus. Anxiety waking on, arsenic album and lakhs. A very dangerous symptom. Very, very dangerous symptom. I know a lot of people know. Aversion to the husband. Which remedy? Achha, Bharti ji, you are great.
How about the wife?
Aversion, huh?
Version to the wife?
No, I won't tell. Otherwise, I'll be my wife is sitting there, she'll kill me. Aversion of the family members. Good. Company aversion to during urination. Anatomy only. Difficulty in, I tell you, whenever I get a case of this remedy, maybe you think I'm joking. No, I always, whenever I take this case and this remedy comes, so I said, oh, please tell me. So please anyone raise the hand. Anyone, one person. Please raise the hand. Dr. Garg, what is 37 plus 73?
100.
Very good. 99 people will say 100. Because you're not next one. Guaranteed you're not next one. And then dancing. All the time somebody dancing like this. Tarantula, yes, you're right. And then cowardice, not very bold. Another one, gelsemium. Both remedies are good. Despair itching from, oh my God. I have treated more than thousands of cases of eczema where they are having itching. Oh my God, oh my God. Oh my God, despair. And single remedy, single dose. Huh? Yes, flute. Suriname, 1 1 dose. You see the magic. But Suriname works in 9 days, and you shouldn't drink coffee when you are taking Suriname. Tell them no coffee, then Suriname will work. And then dullness children in. Kids are sitting, oh, my son, my daughter, they are always sitting there, but not doing anything. What's the remedy? Argentum nitricum, britacard, calcium, and sulfur. And dullness in the old people. Yes, britacard is there. And another remedy is ambergris. Finally, few more indications, then I will finish. And foolish and happiness together. Foolish and happiness. And with the pride. Oh, don't worry, I'm foolish. Aha. Wow, I'm foolish. Sulfur. Yes. And somebody is not drunk. You see him, he is like a drunk. Remedy. $10. Very special remedy, hyocyanates. Yes. Somebody writing something. There are 2 remedies. One, he writes and he can't read, is lycopodium. And another remedy, which is writing very fast. Remedy, please. No.
Sulfuric acid.
Yes, sir. Yes, sir. I salute you. No, it's good. If somebody saying it's good,
Yes, exactly.
single remedy writing very fast, sulfuric acid. And then kicking during sleep. Pardon? Somebody is kicking during sleep, kicking the quilt. You see a lot of belladonna. Somebody will live like somebody like remedy. Remedy, please, Dr. Nanda Kumarji. Somebody is laughing. Somebody laughing very loud. Belladonna. Single remedy. Stop. No one can challenge. I leave this paper here. You can have a photocopy because I didn't have the time to photocopy. Yeah? And then two, 3 more. Obstinate, very obstinate people. $20. No. $100. No. Argentum nitricum. Restless sitting at work while when somebody is sitting at work, but they're very restless. No. 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 That's why I bring this paper. Huh? Graphitis, please. You can go and see the country party. Yeah, there's no lying. Sadness itching from. Sadness, I'm very sad. I'm very sad. Yes. I told you, Suriname. Sadness, itching from. Sleeplessness, itching from. Suriname. Never fail. I have Suriname 1M special bottle from Bilmer Shobe. Every time it's finished, I fear because somebody coming and itching, and I know this Suriname will be there. Yeah. And then shrieking trifle without anything shrieking. No. It's small thing and shrieking. This is homeopathy magic. Single remedy, please. Kalikar. Shrieking without any small. You can see on the high street, there are a lot of people and girls and boys are shrieking for nothing. And then somebody is sneezing. Remedy, please. Startled, sneezing from. Suppose I'm walking and somebody says, oh my God, he's sneezing. What is it? Intelligent girl, clapping for her. I didn't know you know that much. Okay, 3 more to go. If somebody is saying, excuse me, touch them and they startle. Sometime my wife also do this. Sorry to say. I'm sorry. My wife is sitting there. When I go to her, I say, Sunita, is there remedy, please? I'm going to kitchen to find out what she's cooking. And I say, yeah, Kalikar. Kalikar, startled when somebody touching without notice, yeah, without her being noticed, yeah. Always say Kalikar. And there are 3 more to go. Somebody going in the market or high street, and they are very angry. They want to strike somebody. Remedy. They want to strike somebody, hit somebody for no reason. Hyosams. Very important remedy. You don't know me, I don't know you, but they want to go there. Bloody hit him. I shall him. I kick him. The dog kick him. Hyosams. The final one. Another 2 more. Immediately going in the public places. I know. Sure. You got another coffee for you, okay? There's one more remedy. Silesia. Finally, we all know. I mean, we all know. Weeping, telling her sickness from. And then which remedy? Pulsatilla, sepia, Kalikarp, and one more nosode. One more nosode, very important. This is not nosode, sir. Medorinum. Dr. Garg is very intelligent. I didn't know that you are that intelligent. That you come from 7,800 miles away here. So thank you very much. I am finishing in time. I'm giving you 5 minutes. And I thank you, especially thanks to my dear brother, Dr. Sharam. You made our day. And your smile is worth a million. I will keep this picture in my mind for at least 20, 30 days. And my wife really said, thank you to doctor. He gave you a lot of support. And thank you for, originally we have got a good news and bad news. Good news, I was bringing more than 30 people with me. And the government of Canada said, no, sir. You're going for conference for 1 day. No, we don't believe you. We don't believe you. Please. So 21 people rejected. Only 4. The first 4 was here. And one of my dear doctor, he was so passionate. I remember him today. He died. Dr. Anveer Benz. Thank you very much. And thank you all attending today. And I hope you enjoy the day. Maybe we'll meet in future. And we keep in touch with each other. And many, many thanks to Dr. Shah. Please come here. And I want to hug you, please. You're my brother for life.
Sure.
Thank you, sir.
We all almost have the same name, Sharma.
Thank you, everyone. Thank you very much. Go home safe. Thank you. Thank you. And a special thanks to my wife. He said, I'm coming, giving company and everything. I'm with you. Thank you, Sunita. Thank you, sir.
And thank you all. And thank you for all of you who have been online and patient with us. It was lovely to have you all here. I wish you a fantastic evening. For some of you who came from a far place, have a nice return home, safe. And those of you who came from UK or India, enjoy your stay in Canada and have a wonderful trip back home and a very safe trip. It was so wonderful to have a group of people together. I think since before COVID, we haven't done that in such a large gathering. So it was an amazing opportunity. And thank you for everybody who joined us online. It's too bad. I wish we were all together. But thank you. Give you hugs as Dr. Sharma gave me a nice hug. But enjoy your evening, and hopefully we're going to have more of this in the future.